Knowledge is strength, and we have always aimed to empower the people. So, here I welcome you to the day 19 of Homeopathic Learning Series by Team Homeopathy 360 along with its collaborators. I welcome each one of you to this to the webinar to today's webinar. A very warm afternoon to all of you who have joined us today. I, Dr. Yashika Arora, feel privileged enough to be the moderator of today's session for all of you. As you all know that this webinar series is running since past 20 days, and we have tried our level best to get you the most experienced and the expert faculty from all over the country to provide you such a homeopathic training with a solid foundation in the principles of pure homeopathy and how to integrate them into practice. So here we are today with two different topics, two different speakers, and who are going to guide you on Organon of medicine as well as Materia Medica part. Today, our topic for the session is, and I hope everybody is excited again today to attend this session as well as get guidance from great speakers of the country and great lecturers. So we'll try our best to provide you whatever best we can. But before I begin this session, let me just acquaint you with the members of my team who are there in the who are all behind these webinar series and this webinar as well. So I would like to thank Mr. Manish Jain for the first, who is behind this idea of webinar series, the homeopathic learning series, as well as Dr. Rajesh, who is with us at the backend system to ensure that the webinar runs smooth and is always looking after each and every technical aspect and is there at the backend always. I also want to thank my team who is looking after the promotions and all of these things and all updates they try to upload on the website. So thank you so much to the whole team of 360 for your contribution. And also I want to update whoever has joined us today for the very first time. I want to update that you have a chat box on your screens on the right side corner wherein you can type your questions and send to us by pressing the button next to the box. So we'll be running question answer session at 2 points today. That is one at 4:15 and one at 5:45. For the first speaker, you can clear your doubts at 4:15 round, and for the second speaker, we'll be running a question answer session at 5:45. So I hope everybody is clear with the technical aspect and how the webinar will go on. So now it's high time to introduce the platform of Homeopathy 360, which is an exceptional education hub for each generation of homeopaths. I try my level best to organize each and every single information related to homeopathy on the to be updated on this website and provide you. Make it universally accessible. We try our level best to give to present research papers from different stalwarts as well as our journal like Homeopathic Heritage and Homeobuzz. We always try to publish each and every latest news, event, job vacancies everywhere. Right now in the lockdown period also we try to update in it each and every one for the job vacancies. Also, we provide a platform for all the esteemed homeopaths who can contribute your knowledge as well as your expertise. We provide you a platform to publish your articles, your presentations, your videos on the website of www.homeopathy360.com. You can mail me your articles, your presentations at yashika@homeopathy360.com. You can also follow us on our social media accounts, or you can directly submit the article on the website as well. So now let me just introduce you to the its dignified speakers of today's webinar without wasting any more time. We have two great speakers. People trust him, confide in him, appreciate as well as follow him as an inspiration for all of his efforts. He does amazing things for people, so that the system doesn't lets down, and he is one of the best. He's one of the inspiration and one of the best homeopaths of the country presently. So I would like to invite our first speaker who is with us, Dr. Saptarshi Banerjea, sir. He is the gold medalist in BHMS honors in 9 subjects of Health University and MD home, as well as he is the overseas consultant at Orawan Holistic Institute, Thailand. He's also a visiting lecturer for PG Home at Tokyo, Japan. He's also a visiting lecturer at Allen College of Homeopathy, England. Also, being the fifth generation homeopath, he has inherited the wisdom and homeopathic heritage of over 100 years from his ancestors, and he inherits his clinical acumen and wisdom from his illustrious father, Dr. Subrata Banerjee, sir. So I welcome him to the platform on behalf of Team Homeopathy 360 as well as BJN Group of Companies. He was being awarded a gold medal for his first position in All India MD Entrance Examination, Calcutta 2013, and has a teaching experience since many years. He organized monthly postgraduate workshops in Malaysia and Bangkok, Thailand, at Dr. Orawan Holistic Institute since 2013. He has been taking lectures at Bengal Medical Institute, which provides international programs for overseas homeopaths. He also conducts a postgraduate program in Tokyo, Japan. So I welcome him to the platform, and he'll be discussing on the topic of astonishing classical cures from the consulting room of Bengal masters in pre-independence India. So it's a very innovative topic and a very interesting topic as well. I hope everybody is excited to listen to him. So I welcome him to the platform. Plus, I also welcome our second speaker who is with us. She'll be discussing on Materia Medica part, and for her I welcome on our platform. On such a short notice she was ready to present as well as be with us, and she is a perfect example of perseverance and dedication, which lasts a lifetime. And I welcome her to the platform, Dr. Rashmita S. Petkar, ma'am. She is the assistant professor in the Department of Materia Medica at JIMS Homeopathic Medical College and Hospital. She has completed her MD in Homeopathic Materia Medica at DHAWALE Memorial Homeopathic Institute, PALGHAR. So I welcome her, and she'll be discussing on understanding Mercurius Solubilis through a case study approach. So we have very interesting topics coming up today. And without wasting more time, I want to invite our first speaker as people are excited to listen to him, learn from him. Saptarshi Banerjea, sir, I hand over the session to you. Over to you, sir.
Thank you. Thanks a lot. Hello and good afternoon, everyone. Those who are joining in from India, if anyone joining in overseas, welcome to whichever part of the
Sir, your
world you are.
audio, please, on your audio.
Can you hear me now? Hello?
Yes, sir, I can hear you.
Yeah.
Yes, I can hear you.
Sorry? Can you hear me,
Yeah,
please?
we can hear you. Please start.
Okay. Good afternoon, everyone. Those who are joining in. We have a very interesting topic today, which I'm going to share with you, and that is about very interesting clinical cures which happened pre-independence India. So if you see, the heading I have mentioned is Astonishing Classical Cures from the Consulting Room of Bengal Masters in Pre-Independence India. So Bengal has always been one of the pioneers in homeopathy since very early 1900s. And somewhere down the line, it may have lost its shine and glitter. But I'll present to you over the next hour some very interesting and fascinating cases to show to you that how masters of Metromedica from Bengal, who had a profound grasp on Metromedica and as well as comparative Metromedica, prescribed on a few symptoms. And sometimes they did not always have the repertory with them, they did not have a computer software with them, but still they made miraculous cures. And few of the stories I've heard from my ancestors, from my granddad, from my dad. There are a few I have collected from Hanneman Publishing Company. You know, Hapco is a very old pharmacy, and they have a library section. So I have gone there, I have looked at old journals of Hahnemannian gleanings, and I have collected few very fascinating cases which I'd like to present to you. And one of the major important things why I want to share with you these cases is some of these remedies I have applied with patients, and my ancestors have applied with patients with very good results. So at the end of the day, it's always a clinical functioning, so that you can apply what you learn. So that's one of the major aims of this next hour. Bradford called Cothan the Mecca of homeopathy, but late 1800s, early 1900s, Calcutta was also known as the Mecca of homeopathy. So I want you to sit back, and I will take you back to the golden era of homeopathy in India. The time when India was still under the rule of the British Empire, but homeopathy was thriving and very popular, especially in the eastern part of India. I'll share with you few very pioneer, stalwart homeopaths of those eras. They may be Bengal, Indian in origin, or they may have come here for different purposes, but were enchanted by homeopathy. So I'll share with you few very interesting homeopaths and their very, very fascinating prescriptions. John Martin Honigberger was one of the very early homeopaths to set foot on the Indian soil, and I've read many articles where he was called as the cholera doctor. You understand, cholera was quite a prevalent problem in those times in the subcontinent. And one of the very useful medicines which he used was quassia. If you have a look at your Borica's Medica later on, if you have Borica, all these medicines I'm sharing with you, and these cases you'll find in Borica, you'll find in Clark's Dictionary, and you can have a look later on. And quassia, if you look in Borica or any other Medica, you'll see it's mentioned it's a gastric tonic. So whenever there is a lot of dyspepsia, especially after dysentery, especially after a fluid loss or a gastroenteritis, quassia was a remedy which was prescribed. In those days, there was no chances of IV drips for everyone, so there was a lot of fluid loss, and there was a lot of general debility from that. I've read through cases where cinchona was obviously prescribed, considering the loss of fluids and debility, but in many cases cinchona didn't help. In many cases, arsenicum didn't help. Honigberger did very good results with quassia, and that's why he had very appreciable results in cholera and known as the cholera doctor. And quassia, I want you to have a look later on, where it's mentioned as a gastric tonic. So if you think of why and how you'll use this 100 years later, you can think of cases where there's a lot of weakness. You can think of cases where a patient had an attack of gastroenteritis, where there's severe vomiting, severe purging, and a result of that there is debility. Prescribe cinchona, prescribe arsenic, prescribe camphor, not working. Try quassia. Honigberger prescribed in tincture, but obviously potencies can help with quassia as well. Another very interesting prescription of Honigberger was Dalkamara. Maharaja Ranjit Singh, I'm sure Indians especially have heard of Ranjit Singh ji. And Dalkamara was prescribed to him for swollen feet and inability to speak. So those were the two symptoms which Honigberger mentioned. And you understand Dalkamara has a lot of dropsy in it, but you don't often always think of Dalkamara other than respiratory sphere. But these cases, which I'm going to share with you over the next hour, will sometimes help you to go out of the box, because we have our favorite remedies, and we tend to limit our favorite remedies to certain sphere of actions. Like Dalkamara, most of us are using it for an acute cold. Most of us are using it for coryza and catarrh and respiratory disorders. But even for dropsy and aphasia as well, which is inability to speak, Dalkamara was prescribed, and with very good results. And prescribing these remedies to rajas and kings in those times made homeopathy even more popular than it was ever before. So quassia is a very interesting medicine. I myself have tried this, and I've heard from my dad as well with very good results, and I want you to please try quassia. Quassia. It's mentioned Borica. Rajendra Lal Datta. He's another very famous Indian homeopath, Bengal homeopath. He was born in a very famous and affluent family. If you read the history of homeopathy in India, you'll see it is mentioned he is the father of homeopathy in India by curing a lot of famous personalities, and he was the one who converted Mahendralal Sarkar to homeopathy. I'll talk about Mahendralal Sarkar later on. Very interesting case which I'd like to share with you. It's not a very uncommon case, but this was a very senior conventional physician in those times, B.L. Baduri, who was treating a boy of a zamindar, and he had tried every avenues, but he was not curing. The zamindar had called R.L. Datta and said that if you can cure my son, and this really felt insulting to Dr. Bhaduri. He said, if anybody can cure his son, I'll burn all my books. So the zamindar called the homeopath in favor of the conventional physician, and this made the conventional doctor feel very humiliated and insulted. When Datta went to see the child, he was tossing about in agony. So there was a lot of tossing with the abdominal colic. He prescribed a single dose of chamomilla. No other questions were asked because of the tossing, and he was a very irritable and impatient child. Within half an hour, the child got better. And the conventional physician kept his promise. He burnt all his books and went to study homeopathy from Datta. So, these are few miraculous cures. Half an hour, a child who has been suffering for so long time, chamomilla single dose, and made him better because of his impatience, because of his tossing. Chamomilla is one of the Nash's trio of pain remedies, aconite, coffea, and chamomilla, and he cannot bear the pain. Just based on that prescription, and completely better. So another beautiful case of colic. You see, and I'll share with you cases where there were different angles of prescription. This was a prescription based on observation. So he looked at the child. He was tossing up. I've not mentioned the entire case here, but the child was really tossing about in agony. The child was really shouting and snappish. So those were just the observations from Datta, and that made him prescribe chamomilla. Done. No other questions. Did not spend one single day on asking dreams and delusions. Just prescribe on what you see. Cured. I'll come to another famous homeopath in pre-independence India, Mahendralal Sarkar. Mahendralal Sarkar was only the second MD of conventional medicine who converted to homeopathy. Again, he prescribed homeopathic remedies to very eminent persons of then British India. And he frequently experimented with snake venoms as well. So experimentation was much alive during his daily practice as well, although he was very busy with patients. A very interesting case, which I, again, have had the privilege to apply it with patients with good results. Severe diarrhea, a person. And this person with the diarrhea, Sarkar found all of his symptoms are pointing to sulfur. And one of the features of sulfur is always a hot nature of the discharge, acrid nature of the discharge. So to confirm his prescription, he just asked another question. Does the stool feel really hot when passing? Just before writing sulfur, he asked this question. And the patient astonishingly said, cold sensation I feel. I do not feel hot. Whenever I pass the stool, whenever I pass flatus, it feels a coldness in my rectum and anus. Again, you see, I'm sharing with you different avenues of prescription, the different ways you can prescribe to reach the totality. Hahnemann mentions in 153 signals, peculiar, rare, uncommon symptoms. If they're striking, you can prescribe on the basis of that. So although the entire totality was in favor of sulfur, whenever he heard this uncommon, peculiar sensation, a striking, singular symptom, the cold sensation while passing stool, a cold sensation while passing flatus, he ignored the broad totality, he ignored the general totality, and he went for the PQRS. Conium was prescribed, single dose, completely got better with conium. Again, a symptom which you can apply with patients. Whenever you look up in Boger's repertory, Bonninghausen's repertory, you'll find under cold flatus, under cold flatulence, conium is a single remedy medicine. And perhaps that was his source of prescription. But again, I've applied this with patients with very good results, a cold sensation while passing stool and flatus. So you see again another avenue where you are prescribing on PQRS, striking symptom, singular symptom, and you are negating the entire totality in favor of a single symptom. And the patient was cured, and that is itself justification for that. So conium are the very useful medicine. Hot sensation, you have that in sulfur, you have that in Nux vomica, you have that in aloes, but a cold sensation while passing flatus and stool. Do remember, my friends, Conium is your PQRS. I'll take you to another fantastic homeopath, and that is Dr. P.C. Majumdar. He was again inspired by his father-in-law Bhaduri. If you remember, I just shared with you earlier on the story of Bhaduri. See how everyone is connected. Bhaduri was trying to treat the child with the colic. He was not successful. And when he saw Datta curing the child, he converted to homeopathy. Now he, on the other hand, he converted his son-in-law to homeopathy. He established the Calcutta Homeopathic Medical College. I'm sure you've heard about it. The oldest homeopathic college in Calcutta and in Asia. And I'll share with you a few very interesting cases of this man. Here I'm sharing with you how he prescribed based on the sphere of action, how he prescribed based on the pathology. A young man, age 25, recurrent fever, pale, anemic, abdomen is hugely distended, no chances of ultrasound, so forget about getting a specific diagnosis. But he had an enlarged spleen. Obviously, he did in palpation. There was a huge enlarged spleen. Liver was enlarged as well. And you understand in those times, in that era, quinine was, like an everyday pill. So everyone who had a spleen and liver enlargement took quinine like anything. So large doses of quinine, they took it and it made the condition even more worse. So you see, again, a prescription based on particular symptoms. Whenever you think of totality, sometimes we all jump up and down thinking that what mental symptoms he has, what is his emotional sphere. But if you're not getting anything very peculiar emotionally, don't strangulate the patient, don't throttle the patient to get the mental symptoms. Right? You see, even in these cases, you can frame a totality based on even the particular symptoms. Aphorism 7, Hahnemann never said totality of mental symptoms or totality of physical symptoms. Hahnemann said totality of symptoms. So it can be a totality of even the particular symptoms. It can be a totality of even the sphere of action. So if you see here attacks of fever, a pallor, anemic appearance with enlarged spleen, enlarged liver, I want you to try this medicine, my friends, Ferrum arsenicosum. If you see in Boric in the relationship of Ferrum Phos, you'll see it's mentioned about Ferrum ars. It's in the relationship of Ferrum metallicum, Ferrum ars. I'll just read from Boric. Enlarged liver and spleen with fever, undigested stool, albuminuria. My friends, my granddad, my dad, myself, we have had very good results, especially in the subcontinent. If you come across cases of recurrent malaria with splenomegaly, if you come across cases in the subcontinent of thalassemia, where children, even adults, require recurrent blood transfusions. You'll come across cases of thalassemia where they're requiring blood transfusion every week, every other week. And with the help of these remedies, especially like a Ferrum ars, you can gradually increase the span of the blood transfusion. And Ferrum ars is such a useful medicine. And my dad referred to me this case which he had read, and I noted down, and I've had very good results with Ferrum ars. I want you to please, whenever you go back to cases of splenic enlargement, cases of anemia, where your Ferrum met has failed, where your Ferrum Phos has failed, try Ferrum ars. So splenomegaly, hepatosplenomegaly, or liver and splenic enlargement in an anemic constitution who is very weak. Why weak? This is the weakness of arsenic. So the debility of arsenic is there. And very good results can be obtained with Ferrum ars. 6C was prescribed in this case, but we have had very good success even with 30C, 200C, and 1M. I want you to please go ahead and try Ferrum ars, my friends, and I won't be disappointed. You see, these are all practical clinical experiences which I'm sharing with you. It's not just for a webinar you hear and tomorrow you forget it and go ahead. But whoever are dealing with patients, I'm sure you'll come across cases everywhere across the subcontinent where people do not have the access to recurrent blood transfusions. People don't have the access to proper health care and, regular hematological assessments. And in those cases, I've seen very appreciable results with Ferrum ars. The pallor goes away, the weakness gets better, even the splenic size gradually starts to diminish as well with Ferrum ars. And this is, I think, a very good example by Dr. P.C. Majumdar. Another very interesting case. You see, there are quite a lot of cholera cases. You understand that was one of the prevalent problems in those times. But still, you cannot ignore it because it's a cholera case, but there's always something up for grabs to learn. Old woman. Diarrhea, vomiting, lot of cramps. Numbness of the entire body. Most symptoms disappeared under treatment of a young homeopath. A young homeopath had prescribed cuprum based on the cramps, based on the diarrhea. New symptom appeared when Dr. Majumdar was treating him. Rapid breathing, asking for windows to kept open. She was suffocating. Now, whenever you hear about desire for open air, desire for fanning, you will obviously remember Lacases and Carbovec, who are your top two polychrists for fanning desire. And especially whenever you have a gastroenteritis with this kind of air hunger, you'll always think of Carbovec as your topmost remedy. I'm sure you agree with me. Carbovec was prescribed, no change. And here, my friends, I want you to understand this medicine. Argentum nitricum was prescribed. Majumdar did not mention the reason. So I thought, why arginate? He may have some anxiety. But then I thought of reading up books, and if you see in any Medica, you'll see it's mentioned, even in Boriquet's modality section, you'll see it's mentioned they're better by eructation, belching. So whenever they bring out the wind, they feel much, much better. In Boriquet or in Allen's, you'll see it's mentioned explosive belching in neurotics. So there's a lot of belching you'll find in case of Argentum nitricum. And like Carbovec, they're better from the belching. So that's very, very classical for arginate. At the same time, if you see there's a line in Allen's as well, chilly when uncovered, yet they're smothered when wrapped up. So even when you close the doors and windows, they feel really smothered and suffocated. And arginate has a claustrophobia, so they cannot bear closed spaces. So they want the doors and windows open. And from then on, my friends, I'm sure anywhere and everywhere in the world, you'll come across cases of flatulence and gastritis. And whenever you have prescribed cases of Carbovec with the better by eructation, with the air hunger, and you're not getting desired results, don't be disheartened. You always have arginate at your disposal. And my friends, even if you do not have the anxiety, even if you don't have the apprehension, even if you don't have the psychic diarrhea, prescribe Argentum nitricum if they are better by eructations, if there's a lot of explosive belching, and at the same time, if they want fresh open air. Because on one hand, they feel smothered up, but at the same time, there's a claustrophobia component to arginate as well. And believe me, I've had very good success in cases of belching and gastric issues where Carbovec was given without appreciable results. And my friends, those who have attended my programs earlier on as well, they do also know that I share with you that whenever you come across these remedies, always put a note in the books which you use in or in a computer, wherever you have notes. Say you have notes for Carbovec, put a note. Whenever Carbovec fails for belching and better in open air, try arginate. And I'm sure you'll find avenues to prescribe these medicine. Otherwise, you'll be sticking to your thought process that yes, if there's only anxiety, if there's only those fear of heights and impulsiveness, I'll go for arginate. But you understand, every polychrist has different facets of prescription. And here, arginate is another medicine where it's prescribed based on these symptoms. And you see, again, there's another different way of prescribing. You're prescribing based on relationship of remedies. So whenever a medicine like Carbovec is failing for similar symptoms, if that doesn't work, try arginate for similar symptoms. So prescription based on failure of the first prescription, a prescription based on relationship of remedies. When Carbovec fails, arginate comes to your rescue. Another very fascinating medicine, and I want you to please use this. See this interesting story. A young man, hard work at office, fainting, so very weak, drugged with conventional medicine. You understand, this is 1900s India, and medical healthcare facilities was not up to that pedigree. Urine was blackish red in color, and the kidney region were very sensitive to pressure. So whenever somebody pressed the renal region, the renal angle, it was very sensitive. A lot of thirst. a lot of burning all over, restlessness, feverishness, vomiting. It was a bitter vomiting. Nux vomica was prescribed because you understand the history given here. He was drugged with conventional medicines. But Nux vomica helped to a certain extent. But if you see the features here, thirst is excessive, there's a lot of burning, there's a lot of restlessness. And whenever you think of these symptoms, you will always see that these are few arsenic symptoms here. What are the arsenic features? Restlessness is arsenic. Thirst is arsenic. Burning is arsenic. And there's a lot of debility as well. So fainting and weakness, fatigue is there. That is arsenic as well. And there's another avenue of prescription, my friends, I want you to understand. Sometimes you'll come across medicines. Say you have prescribed a polycrest. You have prescribed the arsenicum here, but arsenic isn't responding. You retake the case again, and you still find that it's a very good totality of arsenicum. It's still not responding. I want you to understand there are very interesting satellite medicines of these big polycrests. So whenever you think of a medicine like arsenicum, it's obviously a big polycrest can cover head to foot symptoms. But there are always opportunities to think of satellite medicines to prescribe whenever your well-selected polycrests have still a good totality, but it's still not working. You see, sometimes you'll feel, it's an arsenic totality, but perhaps my prescription is wrong, and you feel frustrated, you give up. But you always have to remember, perhaps I need a very specific remedy which is of this group, but which will work with these symptoms. So what was the sphere of action of this patient? Renal hemorrhage. So he's having bleeding with the urine. He was having kidney symptoms, pressure in the renal region with the arsenic totality. You see the urine examination, blood was present, renal casts were present. You understand these are very superficial examination. They were not very specific in today's time. But the remedy is still valid. The remedy is still useful in today's world. I want you to have a look later on in your boricae for arsenicum hydrogenisatum. And there's a very specific arsenic medicine, very specific satellite medicine, which you prescribe for specifically kidney problems. I'll just read the introduction from boricae. General action of arsenic more accentuated. Anemia, hematuria with general blood disorganization, hemorrhages from mucous membrane. So where the hemorrhage is from? It's from the kidney region. Urine suppressed, followed by vomiting. Coldness, sudden weakness and nausea. So all the arsenic symptoms, but its specific affinity is for the kidneys. Again, my friends, I want you to please try this medicine. I have had very good results with arsenic hydrogenisatum. In the subcontinent, anywhere in the world, you'll come across cases of renal failure, patients requiring hemodialysis, and they are frustrated with conventional treatment. You understand, whenever somebody is taking dialysis 2 to 3 times a week, the general sense of well-being is destroyed. And with a remedy like arsenic hydro, you'll always be able to gradually reduce or increase the time span of the hemodialysis, and the kidney function has improved in very many cases. So I want you to please try this remedy. 12x was prescribed in this case, but obviously any C scale can be helpful. Lm potency, if available, can be helpful as well. And I want you to please use this medicine. It's a fantastic medicine. Many cases of kidney failure, whenever you have tried arsenicum album, you're finding it's still a good totality of arsenic with the anxiety, with the restlessness, with the thirst, with the burning, but still not working. Give a second thought to arsenic hydrogenisatum, and I'm sure you won't be disappointed. You see, the follow-up was also mentioned, and no vomiting, no fever, urine had no blood. He spoke rationally, he wanted some more food, so the appetite improved. And you understand, such is the beauty of these remedies. Here, a prescription based on satellite prescription, where you know your polycrest, but sometimes smaller remedies of that group can really help on specific symptoms to prescribe. Again, another very interesting case of splenomegaly, splenic enlargement. I shared with you earlier on with the weakness of we're talking about arsenic. Arsenic with splenic enlargement and anemia, I gave you Ferrum Ars. Arsenic with kidney symptoms, I gave you arsenic hydrogenisatum. So you see, smaller remedies of these big polychrist group can always help you if you have a very specific complaint, A. B, if you're not finding good results. Obviously, you will try your polychrist first. I'm not telling you to try these small remedies first. Always pin your hopes on your polychrist. Believe in your polychrist. But whenever you're not finding appreciable results, you always remember you have these smaller brothers of the big polychrist to help you whenever you're stuck. A case of splenomegaly, my friends. This is interesting again. You see, this is a case where you see the date July 1896, but still they did all the clinical examinations. They examined the heart, they examined the breath sounds, the heart sounds, and the history was got. He stayed in a malarious place for 5 years, and there was an enormous splenic enlargement, even reaching beyond the navel. So even beyond the navel, there was an enormous splenic enlargement. And there was obviously due to the pressure symptoms of the splenic enlargement, dyspnea on walking very fast. So although he was diagnosed by conventional physicians as heart disease, but you see the importance of auscultation, the importance of physical examination in today's world still is important, because whenever the case was examined and they found there was an enormous splenic enlargement even up to the navel, and probably the dyspnea was because of that, the very interesting medicine was prescribed Ceanothus. So you see, if you do a quick comparative Medica, I shared with you Ferrum Ars was splenic enlargement with lots of weakness and very pale and anemic appearance. Sometimes you may get the restlessness and anxiety of arsenic as well with Ferrum Ars. But in case of Ceanothus, there are two features here. You're getting an enormous splenic enlargement, so it extends even like a forefinger or 5-finger enlargement, and along with that there is a lot of breathlessness worse from exertion. And Ceanothus is a very useful splenic enlargement medicine as well, which you can prescribe for thalassemia cases of malaria, and which you get so much in the subcontinent. So what I learned about splenomegaly and Ceanothus in comparison to all other splenic enlargement remedies, obviously there are many splenic enlargement remedies, is in Ceanothus the enlargement of the spleen is huge, and that is one of the reasons of prescription. I'm just reading from Borike here. Remedy seems to possess a specific relation to the spleen. If you look in the abdomen section, it mentions deep-seated pain in the left hypochondrium, hypertrophy of the spleen, and it's a huge hypertrophy, and that's what mentioned in the case which is mentioned. You see, I've mentioned that enormous spleen reaching up to the navel with Ceanothus. And these are two, that's why I shared two splenic enlargement cases from the same author by P.C. Majumdar, and he mentions about Ferrum Ars on one hand, mentions about Ceanothus on the other hand. Dosage here is according to the author, but obviously if your medicine is correct, you can choose your dose and potency accordingly. So I don't have any say with that, but do remember the indications, which is in itself very classical. Another very interesting case, and my friends, even before reading up this case, I knew about this remedy, but had prescribed, but later on when I perceived this case, my understanding cleared up, my blurring cleared up with Paris quadrifolia. I don't know if anyone have used this medicine, Paris quadrifolia. Paris is prescribed sometimes for neck pain which radiates to the hand. So there is, like a neck pain syndrome which radiates to the hands and fingers with a lot of numbness and tingling. Paris quadrifolia is prescribed many times. But it's an even far superior medicine for emotional issues. See this case. This was a woman, age 45. Son died a year earlier. And taking you back to 1893, she couldn't be consoled. Very morose, very dull. Every 3-4 days, she was having attacks of loquaciousness, sometimes maniacal attacks. She was tearing her own hair. She's throwing up things. She was thinking of a lost son. Headache, very sensitive, vertex is sensitive to touch. She felt as if eyes are protruding from the socket. So it's like a hysterical reaction. A ball lodged in the throat. Coldness of the right side of the body, left was hot. You understand, all these are hysterical manifestations, like a globus hystericus, like a variant temperature, coldness of one half, heat of the other part, eyes are protruding, loquaciousness, maniacal attacks. Anybody and everybody will close their eyes and prescribe ignatia. You understand, because of the history of grief, the hysterical manifestations, the mood swings. But you understand, with this case, it was getting quite out of control. And what I obviously I have mentioned the case in a nutshell, but reading through the case, there was a detailed account of the first day, detailed account of the second day, and it was almost they had to take the patient to the mental asylums. So ignatia was given on the first and second day, but there was no change. And I want to introduce you to Paris quadrifolia. Paris, if you have your Boricae with you, or if you manage to look Boricae later on, I'll just share with you about Paris. If you look in Boricae, much detailed information will be found in Clark's dictionary. You'll see it's mentioned garrulous, prattling, so they're very talkative, very loquacious. You'll come across cases where you're prescribing lachesis, where you're prescribing hyoscyamus, you're prescribing stramonium, but still there's not much improvement. You see in the mind section, imaginary foul smell, so that kind of hallucinations, hysterical reaction. Head symptoms marked and verified. Sensation of expansion. There are two sensations in Paris, and believe me, I've found that with patients. Group A Paris will tell you it's feeling as if it's coming out. The eyes are protruding out. So you see there's a mention in the introduction in Boricae, sensation of expansion. So that you can get with Paris 1 on one hand, A. B, with Paris, you can feel like a pulled in sensation as well. So they feel the scalp is being contracted, so the eyes are being contracted. That feeling you can get in Paris. If you look in Hypersulf in Allen's keynotes, you'll find it's mentioned sensation as if eyeballs are pulled back to the head in Hypersulf, in bracket Oleander and Paris. So either Paris can give you an expanding and protruding sensation, which you got with this case, or Paris can give you a contracted feeling like the eyes are being pulled back into the sockets. And both can be helped with Paris quadrifolia, and have helped in both cases. If you see in the introduction, it's mentioned coldness of the right side of the body, left hot. This is an exact representation of the case mentioned, but still, even if you get a variation of temperature, I found Paris to be effective as well, like the upper part is hot or lower part is hot, upper part is cold. If you look in the eyes section, eyes feel heavy as if they're projected, so that's A, pulling out. If you look in the eyes section, sensation as a string through the eyes, that you can find with Paris as well. So picture in your understanding a very hysterical constitution, very talkative, with a globus hystericus, with a protruding or a contracted sensation, could be in the eyes, could be otherwise, and especially they had a history of grief and disappointment as well. My friends, wherever you have notes for ignatia, put a note. If ignatia doesn't work, I'll try Paris. Wherever you have notes for lachesis, stramonium, hyoscyamus, put a note. If these fail for loquaciousness, if these fail for emotional issues, I'll try Paris quadrifolia. A very small medicine. Sometimes you may ignore it, you may forget about it, but there are some cases, 8 out of 10 you'll help with the polycrest. Maybe 2 cases you'll be stuck. Why not try Paris and have that at your disposal? So Paris can help in those cases with very good results, and I've had very good effective results in hysterical cases where I had, as I mentioned to you, I had used lachesis and had used stramonium, very talkative, and hysterical reaction they had. Those weren't responding. Paris quadrifolia came to our rescue. Potency, again, emotional issues, use 200C, 1M, even up to 10M, you can use with very good results if you're using C scale with Paris quadrifolia. I want you to please try this medicine. I'm sure you won't be disappointed. I come to another stalwart of Medica, and in my last webinar a few days back, I shared with you, if you want to learn comparative Metromedica, no other book will give you a better example than N.M. Chaudhary. N.M. Chaudhary always used to say, and I shared this with all my students across the globe, if you love your Materia Medica, jewels will fall before you like the falls of Niagara. So if you are in love with Metromedica, don't worry about money, jewels will fall before you. N.M. Chaudhary knew his repertory, but believe me, he didn't keep his repertory in his clinic. N.M. Chaudhary was the principal of Bengal Island Homeopathic Medical College. My great-granddad and N.M. Chaudhary went together to study homeopathy in America. N.M. Chaudhary went to learn Metromedica from J.T. Kent. My great-granddad, K.M. Banerjea, went to study miasms from J.H. Allen. That's why miasms came into our family. And when they came back, they started the Bengal Island Medical College in Calcutta in 1920s. And N.M. Chaudhary was the principal of Bengal Island Medical College. And believe me, he knew Metromedica like a mother knows her child. So if you want to learn comparative Metromedica, please do read N.M. Chaudhary's book. I'll give you a few very fascinating cases of this master prescriber. Uterine hemorrhage, prolonged uterine bleeding, uterus heavy, uterus enlarged. You see, on examination, so even in those times in the subcontinent, they did a physical examination of patients. I'm obviously in today's times, in these present times, perhaps we may not always have the opportunity to provide face-to-face consultation, but you understand, obviously, it's much useful if you can physically examine the patient, and M. Chaudhary mentions that as well. And you see, again, a prescription based on concomitant. Persistent hemorrhage was associated with frequent desire for urination. So polyuria, frequent urination with the hemorrhage. You understand that can be sometimes due to a reflex phenomena, so the uterus is enlarged, that is sometimes causing an irritation of the urinary bladder. But it didn't care about, what the pathology says or what the conventional practice of medicine says. We sometimes in today's world are so much gobbled about what is practice of medicine saying and what is uncommon symptom. We forget to ignore what the patient is saying to us. We ignore what the patient says to us. So a small medicine like Michella repens, and believe me, my friends, all remedies which I'm sharing with you is not just good cases which I have picked up from journals. It's cases which my family and I have used with very efficient results, and that's only I'm sharing with you on this platform. Dysuria with hemorrhage. So there is bleeding, there is hemorrhage with dysuria. So whenever you think as a conventional gynecologist, or you think of a conventional medicine physician, you'll think that is a common symptom. There may be some irritation that is causing the uterine, that is causing the difficult urination, the frequent urination. But for a small remedy like Michella repens, this in itself is a totality to prescribe. Herring, if you read Herring's notes, or if you read Stuart Close's Genius of Homeopathy, he mentions that for totality to be constructed, you need at least 3 symptoms. Like a stool always stands on 3 legs. A stool will fall if it's made to stand on 2 legs. So for a chair to stand, it needs at least 3 legs. Similarly, for a homeopathic prescription to be complete, you need at least 3 symptoms. I want you to have a look in Michella repens later on. I'll just read to you from Borike's Metromedica about Michella. Bladder symptoms accompany complaints, especially uterine congestion, irritation of the neck of bladder, dysuria, in the female section, dysmenorrhea, uterine hemorrhage. So not much symptoms. But you see, you have uterine hemorrhage, you have frequent desire for urination, you have difficult urination. 3 symptoms, 3 common symptoms. But you see, you have to understand the avenue of prescription here. Whenever you have put three symptoms separately, these are common symptoms. You put these 3 symptoms together, you make a symptom complex, as Jugal Kishore mentions. And when you put these 3 symptoms together, they make a symptom complex. You understand it becomes a characteristic for Michella repens. So do not always, as I shared with you earlier on, throttle the patient for generals, throttle the patient for mental symptoms. You ask a daily laborer, you ask them what you like to eat, they'll say, I'll like only dal and roti. You ask them what are your dreams and delusions, he'll smile at you and say nothing. Because, after a hard day's work, he only has the opportunity to go to sleep. He'll only give you symptoms. I run a slum clinic every week for very many years, and believe me, my friends, real India, rural India, or slum India will not tell you about, do I like to eat cheese or cakes or pastries. They will tell you, I have my dal and roti, I'm satisfied with that. So whenever you come across symptoms, if you make that complete with 3 symptoms, you make a symptom complex, you have a prescription. Such was the time of N.M. Chaudhary. Michel was prescribed. Uterine bleeding stopped. The urination, the polyuria and dysuria stopped as well. So keynote prescription, where you're prescribing based on A, a symptom complex, B, you're prescribing based on concomitant symptoms. Done. Michel 30C, I think, was the prescription, and hemorrhage and urinary discomfort was gone for good. Another very interesting case. N.M. Chaudhary again. Young girl, 17 years. She wanted her mother to rub her back with hot iron. This is the exact expression mentioned by N.M. Chaudhary. Stiff neck. You see, again, you're done with these keynote prescriptions. Rub her back with hot iron. So there was a coldness in the neck, stiffness in the neck. During the height of fever, cheeks were flushed and eyes were glossy and bright. Top 2 symptoms are in itself a good totality for Lacnanthus prescription. Whichever Metromedica you use, you'll see it's mentioned that there's a coldness along the spine, coldness along the neck. Along with that, there's always a stiffness in the neck and spinal region, and that is a very useful prescription for Lacnanthus. 200C was prescribed in that case by N.M. Chaudhary, and this young girl didn't say about hot iron again. We come back to another case of N.M. Chaudhary. This is interesting again. Bilious vomiting, continuing for 3 to 4 weeks, a lot of dizziness. So this was diagnosed with a case of cirrhosis. Very interesting prescription by N.M. Chaudhary again, curare. Sometimes when I used to look at those cases, sometimes it used to go over my head. Curare is a nerve poison. So my understanding of curare is it's a medicine for diabetes mellitus. It's a medicine for neurological weakness because it's an arrow poison. So it's more neurological symptoms which you find with curare. So I had to look up and understand. And it's always useful to understand different areas of prescription when you come across these cases. And whenever you look in curare, even in Borica's Metromedica, you'll see it's mentioned in the introduction, vomiting of bile and cirrhosis of liver. So bilious vomiting, we'll think of your conventional medicines, Podophyllum, your bilious medicines, Folophyllum, you'll think of Bryonia, Nux vomica, all your bilious medicines, Chelidonium. But again, you see, N.M. Chaudhary found very useful effects with curare. Bilious vomiting, it was a diagnosis of cirrhosis, and the dizziness was important for curare prescription. If you look in the introduction, in curare, it's mentioned nervous debility of the aged. So you can get that degree of dizzy and debility like gelsemium. But you understand the sphere of action here is more towards liver involvement, vomiting of bile, and that's the reason it was prescribed. If you see the introduction, it's mentioned debility of the aged from loss of fluids, nervous debility, and all the weakness and dizziness in conjunction with the sphere of action, cirrhosis, and the bilious vomiting, curare. Very interesting potency. 500C was prescribed. There is no reason for the potency used, so I can't give you a reason. But again, you can use any potency as long as neutrality matches. Again, a very interesting case. A case of colic. 3 months old, 3 months ago, due to a cold, violent pain in her abdomen, loose stools, chamomilla got her better. Stone in the abdomen with diarrhea. Very interesting time of the colic is 4 a.m. every day. The colic used to come, and it used to be there till 8 a.m. So there was a lot of periodicity in the colic. So every day it used to come at 4 a.m. and every day it used to go at 8 a.m. Now, I looked up and I tried to understand that is there any modality. I looked up every repertory, doesn't mention anywhere about 4 a.m. or 8 a.m. But if you look in Medica, Boricae especially, I want you to have a look, and later on, feeling of a stone in the abdomen at the same hour daily. Again, a comparative Medica, if you think of Cedron is a medicine which has a clock-like appearance of symptoms, fever especially, or any other symptoms. But here the patient mentioned specifically that it was a stone-like sensation in the abdomen, and it was coming every day at 4 to 8 a.m. So periodicity with a stone-like sensation. Do remember Arania diadema. This is very, very classical. Remember the comparative Medica. You always remember China for periodicity, but China doesn't have a stone-like sensation. It's more like acidity and more like bloating and fever you'll find with China. If you think of Cedron, as I shared with you, it can have clock-like periodicity. Again, that can be for specific complaints. But whenever it's a very specific, like I feel heaviness or a stone-like feeling, 4 a.m., that time of the day, 4 to 8 a.m., it's definitely a feature of Arania diadema. Arania diadema is the spider, and it's a hydrogenoid medicine because it is a strong damp weather aggravation. So with Arania diadema, with the periodic clock-like periodicity, especially with a stone-like sensation, it comes in really handy. Again, we come back to another very fascinating case of N.M. Chaudhary. Case of constipation. Again, a prescription based on concomitant. And actually, N.M. Chaudhary looked at this girl. She was sitting in the toilet. She was trying to pass stool. Every time she's straining at stool, oh God, she's getting a severe, terrible headache. So every time this child, this young girl is straining at stool, there's always a terrible, terrible headache. No other question was asked. A prescription based on concomitant, Indium, was prescribed. You see, again, these cases, initially, obviously a polycrest was tried. You see, pasty stools, evacuated with straining. Face became purple, so much straining to pass the stool. Sulfur was tried. You understand, in sulfur you have painful constipation in sulfur and painless diarrhea. So based on the painful constipation, the child was desisting the effort to pass stool, sulfur was prescribed. But every time she was passing the stool, you understand, the concomitant is good. The pain is straight radiating up to the head. So it's a lightning feeling in the head. And she was sitting in the toilet with hands on her head. Done. No other question was asked. Indium was prescribed. Any Medica, if you have a look, you'll see it's mentioned for Indium, Indium, where you have this headache when straining at stool. If you open Boricae, you'll see it's mentioned in the head section. Pain in head when straining at stool is in italic during stool. If you have headache from constipation, if your stool is not passing and you are having a headache, do remember Bryonia. If you have a very painful constipation, your stool is not being passed, do remember sulfur. But whenever you have a headache, every time the child is passing the stool, do put a note for Indium. Is a very fantastic medicine. Again, potency was not mentioned in this case. So depending on you can prescribe. But this is very interesting for Indium. And do remember, Indium comes very close to sulfur as well. That's why wherever you have notes for sulfur, put a note for Indium. If you see the Boricae's Medica, if you open Boricae, you'll see it's mentioned in the male section, horrible offensive smell of urine after standing for a short time. So very offensive discharges like sulfur, very offensive urine like sulfur, a very painful constipation like sulfur. But for sulfur, the pain is more felt in the rectum, there's a soreness, there's a burning. But for Indium, this pain is radiating straight through the head, and they feel the pain more in the head region during passage of stool. As the time is short, I will share with you a few very interesting cases which are there. This is by Dr. B.K. Bose. I'm sure you have heard about B.K. Bose. He was one of the pioneers of homeopathy, again a direct student of Kent. N.M. Chaudhary and B.K. Bose were few of the direct students of Kent, and he was the backbone of Calcutta Homeopathic College. the Bengal homeopathy, which was flourishing in pre-independence India, and he's one of the major contributors to that. He was a family physician of Motilal Nehru, father of the first Prime Minister of India. Very interesting case. You see the chain of events, how it unfolds. Girl of 15, unmarried. Dysmenorrhea, pulse quick and heart fluttering, face greenish yellow. So it was a pallor and anemic appearance. Dr. Bose, you understand, you may think, you may raise your eyebrows thinking what he said, but this is March 1940s India, and marriage was around 15 and 16 in those times. This is Dr. Bose's words. I told the father best medicine for her would be a groom. She quoted a slok from Gita, and Gita is the religious book, and erroneously explained to me that to marry was a dangerous thing for a young girl. I argued with her. She got irritated. When she was being cornered in her arguments, she burst into tears. She was tearful even in the midst of irritability. Pulsatilla 200. Why? Pulsatilla, do remember, always has a fear of marriage, fear of having a relationship with the opposite sex. Along with that, there can be a passive irritability in Pulsatilla, which I understood from Dr. Bose's case. And whenever she was cornered, whenever she was unable, helpless to answer, she expressed through tears. And even in the midst of irritability, she was tearful. Pulsatilla 200, dysmenorrhea was better, she got married. 6 months after her marriage, I was called in to see her. She thought the sexual relationship with her husband was very dangerous. You can understand, in today's world, you'll be thinking a girl of 15, that's just not right. But in those times, you have to think in that social context. Pulsatilla CM was prescribed 1 dose. Why is Pulsatilla CM? Again, that constant fear of having a sexual relationship with the opposite sex. Along with that, you have the tearful, passive irritability, which is very classical for Pulsatilla. So it is again the beautiful prescription based on emotional symptoms here. And you understand, BK Bose took over from Kent, so he was a very high potency prescriber. Pul CM was prescribed. Another very interesting homeopath, and Dr. R. Biswas. This was a person in having typhoid fever, 4th week, drowsy, with very bad smelling discharge, offensive discharge. And he could say that, somebody is cooking a very, very strong smelling fish somewhere. And nobody in the family was being able to make out. They thought he must be hallucinating. But when Dr. Biswas went to treat this patient at his home, he went for a home visit, and on his way, he recalled that, yes, I saw very far away somebody cooking fish on a roadside stall, on a roadside shop, but it was very far away for him to smell. You'll be thinking that, I should go ahead and prescribe colchicum because you have the nausea from odor of fish. It is not a nausea, you're not seeing the fish or you're not smelling the fish and you're getting a nausea from that. It is actually normal person, another person A and B cannot be able to smell it, but you, the patient, are being able to smell it. So it's more like an increased sensibility of smelling. And my friends, no other patient has this other than carbolic acid. Dr. Biswas didn't ask any other question. He got the weakness of acids. He got the offensiveness, which you find with carbolic acid. And you got the acute overt sensitiveness to smell, which is so classical of carbolic acid. If you open boric A, you'll see it's mentioned in carbolic acid that increased olfactory sensibility, very marked acuteness of smell is a guiding symptom. So which no other person can smell it, but you can smell it. Here it's mentioned about fish, it can be anything else, but it's just your sense of olfaction is heightened with this ailment. And carbolic acid cured that patient. His olfactory sensibility was gone. His weakness was better as well with carbolic acid. such is a fantastic prescription. You see, again, prescription based on observation. No other person can smell it, but you can. We'll be looking up in nose section, we're trying to find illusion of fish, illusion of fish, illusion of fish. But it's not that. Perhaps if Dr. Biswas hadn't seen that fish stall, he may not have thought about it. But such is the beauty of homeopathy, that he managed to see that, he managed to remember the remedy and prescribed it. I'd like to share with you one of a very interesting medicines or cases which I heard from my great granddad. This was a man with an ulceration of the lip for 3 years. He was being treated, but there was no change. One day he visited the clinic with his young son, who saw a spider on the wall. So the patient, he had a lip ulcer, and he was visiting the clinic of my great granddad for the ulceration of the lip, treating him for 3 years without any appreciable results. So he retook the case and he was trying to find the remedy. And now this child was constantly telling to the father, Dad, there's a spider on the wall. So he kept repeating this gesture, which made my great granddad ask him, I'm sorry for the spider, but this is an old house. So he was a little bit embarrassed that, he has a spider in his consulting room. So a little bit embarrassed. But he asked that, why is your son repeatedly bringing your attention to this? So now the patient got embarrassed. He said, no, we also have spiders in our home. It's also a very old house. But every time my child sees a spider, and I smoke quite a lot, he wants to put the lighted end of the cigarette on the end of the spider's, on the spider's skin. And whenever the spider gets a touch of that lighted end of the cigarette, it jumps up and it goes away. So he feels a thrill, my son feels a thrill on seeing that the spider jump about. Such a syphilitic boy. So you see, this is like an illustration that whenever the child sees the spider, he tells the father that, just put the lighted end of the cigarette. So my great granddad asked just one question. Do you smoke the same cigarette after touching it on the spider's leg? He replied, yes, I do. Latrodectus hasselti was prescribed. Latrodectus hasselti is the New South Wales spider, and it has got a similar ulceration on the lip. And believe me, 1 dose was prescribed, and he didn't have an ulceration on the lip again. So 3 years he had been under his treatment. And you understand, putting the lighted end of the cigarette on the spider, and the spider's juices are sometimes getting mixed up with the cigarette, and he again smoking this, and he is getting that lip ulceration. And let likes be treated by likes. Caused from that, New South Wales spider was prescribed Latrodectus hasselti. Latrodectus hasselti is in the relationship in boricae of Latrodectus mactans, and it has a similar ulceration on the lip, and a classic example of let likes be treated by likes. Latrodectus hasselti 200C was prescribed. And again, a case of luck, that was there not the spider that day in the clinic, perhaps Latrodectus wouldn't have helped the patient. So that's one of the very interesting cases which I've heard, and I thought it's good to share. I'll share with you 2 more cases before we wrap up. Coronary thrombosis. This is a case by Dr. S.K. Ghosh. There's a very beautiful book by Dr. S.K. Ghosh, Rare Nosodes, and he mentions about a case of a 65-year-old man who was suffering from coronary thrombosis for 2 years. No symptoms. Suddenly he felt agonizing pain in the heart at 11 o'clock with severe dyspnea. Pulse was slow, BP was low. And Dr. Ghosh didn't have any constricting sensation like cactus, nor did he have any stitching pains, nor the depression like nausea. And hence Dr. Ghosh prescribed pituitrin. And my friends, I want you to please try pituitrin in cases of angina pectoris where you are stuck, where you don't have the constriction of caged sensation like cactus, nor you have the stitching pains or the depression like nausea. And in those cases, pituitrin will always come to your rescue. Do remember, pituitrin or pituitary gland has got an affinity for organs where there is circular muscle fibers. So think of the heart where there is circular muscle fibers. Think of the uterine musculature where there is circular muscle fibers. Whenever you prescribe a medicine like pituitrin, it helps to as a muscle relaxant. It helps to work as a vasodilator. It relaxes the muscles. So muscle relaxant. And hence pituitrin is a very useful in cases of dysmenorrhea when you are stuck, in cases of angina pectoris when you are stuck, and not being able to decide whether to go for a cactus or a nausea. Do remember you have something midway, pituitrin, where there's severe agonizing pain due to that severe vasoconstriction, severe constriction of the circular muscle fibers, and pituitrin will help to your rescue. 30C was prescribed, and believe me, we have done loads and loads of cases of pituitrin with very good results. I have a video in YouTube as well of pituitrin, which I have uploaded, which contains all the information about pituitrin. And my last case for the day, which I'd like to share with you, is a very interesting case of recurrent suppuration. Edema of extremities. This was a woman admitted in the Calcutta Homeopathic College and Hospital in, again, pre-independence India. Edema with a lot of dyspnea, precordial pain. It was diagnosed as epidemic dropsy. Digital is 200C improved, considering edema, considering dyspnea, precordial pain. Month later, all complaints were better. Enlarged glands in the neck on the left side. High temperature. Glands suppurated, burst one after the other. 2 weeks within that, whole neck was like a bag of pus. So all the neck glands were enlarged initially with high temperature. You understand there was febrile changes, and after that it suppurated. You understand the course of suppurative medicines were prescribed. Belladonna to start with, Hipersal, Silica to after that, after the pus was discharged. But still nothing was helping to completely eradicate the suppuration. So you got a case of recurrent pus formation with a lot of weakness. She couldn't speak, she couldn't swallow anything. Liver was enlarged. Insulin 30C was prescribed. Again, my friends, I've had very good results with insulin, and I want you to try this. Whenever you come across cases of a lot of recurrent suppuration, it couldn't be a recurrent fistula where there is suppuration. It could be a recurrent diabetic ulcer with suppuration. It could be a diabetic foot with suppuration. It could be an abscess anywhere with pus formation, discharging pus. Especially if the patient is really weak and debilitated. Weakness is plus. You have tried all your suppurative medicines. You have tried your silica, you have tried your heper, you have tried mercury, you have tried myristica, still not working. Give a last try to insulin in potency. 30C, 200C, and insulin will help. And in this case, it was a remarkable result. She was still admitted in the hospital within a day. Neck was dry, discharged within a week. And such is the beauty of classical homeopathy. So my friends, I shared with you a few very interesting cases. You understand, obviously, the time is short. I shared with you some of the most interesting ones and which we have had good results with patients as well. So my understanding is what I can do, you can do as well. So I want you to go back, try these medicines with your patients. And I've tried it with you. I'm shared with you different angles of prescription, different avenues of prescription. Prescription based on particular symptoms, based on concomitants, based on symptom complex, based on the pathogenesis. And I'm sure you can prescribe these remedies and come back to me with good results. Thank you very much. Any questions, please?
Thank you so much, sir. For such a nice session. I request the audience to please put up your questions in the chat box so that we can clarify your queries. I request the audience to please type in type in the chat box any questions, any queries you want to ask from sir. Sir, there is a question from Dr. Shraddha. Please suggest medicine for urticaria with itching and scratching, but there is no burning.
Those are absolutely common symptoms, to be very honest. Urticaria with itching and scratching. You need at least a modality. If you have better by cold, look for a modality. If you have better by cold, obviously you can try medicines like Apis as well as Fagopyrum is a very useful medicine. If you have better by warmth, you can try medicines like Rasveninata, which is also better by warmth. So look for a specific modalities. Urticaria as just a symptom, it's very vague.
Thank you, sir. Sir, the Dr. Manisha wants to know, can you please explain psychic diarrhea in Argentum nitricum?
Psychic diarrhea in Argentum nitricum is due to anxiety. So whenever they are anxious, either commonly you'll find with patients, they may not tell you I have diarrhea, but they tell you before I go out, before for an important engagement, there's always an urging for stool. Sometimes I've seen with patients as well, the bowel habits become irregular, or they become more frequent whenever there is anxiety involved. So clinically in day-to-day practice, you may not always find loose stool, but you may find changes with the bowel habits, with the frequency and timing of the stool, with apprehension and anxiety.
Thank you, sir. Sir, there is a question from Dr. Santosh Kumar. Can you please explain arsenic hydrogenum in short, if possible?
I just shared about that. Arsenic hydrogenisatum is a remedy specifically for kidney symptoms, with hematuria, with blood in the urine, with arsenic totality. The case I mentioned earlier on had a lot of restlessness, has a lot of burning, has a lot of thirst, with anxiety as well, which are features of arsenic. But whenever you find a patient with arsenic totality, but his major area of concern is kidney symptoms, or he's on dialysis for renal failure or renal hemorrhage, you can think of arsenic hydrogenisatum. It's available in the pharmacies in 30C and 200C. So it's not a very rare medicine.
Thank you, sir. There's one more question, Dr. Meet Bhagat. Is it beneficial to start treatment with organopathics?
Not really, as I meant.
Organopathic remedy,
I
is it
understand.
beneficial
Yeah.
to start?
Not really, as I shared with you the different cases, and my understanding as well of classical homeopathy is that always try your polycrest first. But whenever you don't have results, like you tried your arsenic, you are not having results, you try arsenic hydrogenisatum. Like I shared with you the case of indium. You tried sulfur first for painful constipation, you have failure with that, then you try indium. So you always give your first preference to polycrest. Only when those fails, you try your lesser known medicine. Like the case of Ignatia, the hysterical nature, you never think of Paris first. Definitely, everyone will think of Ignatia. But again, if Ignatia isn't working, then you'll definitely think of Paris. So that's the thing.
So Dr. Preeti wants to know, can you please explain for how much time we should wait for any medicine to act?
That's difficult to say, to be very honest. It depends on the duration of suffering. If it's a very chronic case, in my understanding, is generally I follow up patients after 3 to 4 weeks. So before 3 weeks or 4 weeks, if you're prescribing in C scale, which I generally do, you cannot see appreciable changes. I've seen homeopaths, my students call up patients every week for a follow up, and it's ridiculous to do so, because a chronic case of psoriasis of 20 years, you won't see changes within a week. If you read Organon, if you read 157 to 161 in homeopathy aggravation, Hahnemann says that you'll see aggravation and then amelioration within the first 7 to 10 days. So at least 3 weeks you have to wait to see changes, especially in a chronic case. But in acutes, you obviously understand it varies as depending on the case.
From Dr. Pronoy, in coronary thrombosis, is it proper to use arnica 3 or Hemabilis for
Sorry, the line got disconnected. Could you repeat that, please?
in coronary thrombosis, is it proper to use arnica 3 or Hemabilis for congestion?
Good question, to be very honest. Coronary thrombosis, you understand arnica acts as a dissolvent of the thrombus. Definitely, you can use arnica. But the case I mentioned and the indication I mentioned for pituitrin is whenever you have a severe agonizing pain. So sometimes, you may not have that severe degree of pain. It may be a mild chest pain, but whenever you have that severity of pain and that has been continuing, that's when pituitrin helps, because not only pituitrin will help with the thrombosis, but as I shared with you, it works as a muscle relaxant. So in those cases, pituitrin can help. Obviously, arnica, any potency can help you with thrombosis if it's mild degree of pain.
Thank you, sir. People want to ask, is there any need to know the mechanism of every symptom? Dr. Chetan is asking.
Knowing miasm is obviously important. We have made a specific course at THA for miasmatic prescribing, but my aim of sharing with you today's cases was sharing with you different avenues of prescription. I didn't share with you miasmatic prescription here, but in many chronic cases, when you are stuck with um, totality, or you're not getting a clear totality, miasm is sometimes very important. If you're stuck between few remedies, knowing miasm is important, as miasmatic prescribing, miasm and symptom are two sides of the same coin. So you cannot ignore one without the other. So obviously that's important as well.
Thank you so much, sir. There is a question from
Sorry.
which medicine should I give? There is a question from Dr. Dimple. Ovary medicines in PCOS.
Sorry, ovary medicines in
Okay, PCOS. I request Dr. Dimple to please elaborate your question and type. Sir, by the time there is one more question from Dr. Deepti, where can we read in details about the cases of pioneers that you have mentioned
sorry,
in
can
today's
you
session? Where can we read about these cases which we have discussed today of
I shared with
pioneers,
you the one of the
etc.?
book was Dr. S.K. Ghosh, Rare Nozodes. The PDF available online. It's about a 20-page book. S.K. Ghosh, Rare Nozodes. N.M. Chaudhary's Metromedica. You'll find the cases of N.M. Chaudhary I mentioned under those specific medicines, and other medicines I have mentioned, as I shared with you, are in different journals. So it's not a one source collection. Few stories, as I shared with you, I heard from my dad and great granddad. So dad and granddad. So it's more like a collected information. But those are the few books which you can get. And there are many Bengali authors as well. So those are written in the native Bengali language. So I managed to translate few of them. But obviously, if you are from Bengal, you can able to read those books. But otherwise, they're not published in English.
Thank you, sir. Sir, Dr. Maya wants to ask, can you mention any medicine for ringworm on knees, over knees, and with intense itching and scaling?
Again, my experience with ringworm, you have to look at the broader totality. You just cannot prescribe on the ringworm. Constitutional prescribing is always the best for ringworm. Many people will tell you about basilinum and tellurium and all those medicines, but to be very honest, constitutional prescribing works best. So that's the answer.
Thank you, sir. Dr. Mugdha wants to know, can a responding cholesteatoma patient benefit with organotherapy?
Non-responding.
Cholesteatoma patient.
Yes, there are certain. If you have a specific group of symptoms, there are some organopathics which can always help. I find Borique very useful for that. If you look in Borique's repertory section as well, the clinical section, that also helps. So whenever you're stuck, so those medicines can help come to your rescue. Do read Burnett's liver and spleen, or Burnett's organopathics. Those can help really well. So whenever you're stuck, if you have specific symptoms, go over Burnett as well.
There is a there is a question: if constitutional medicine is natramure, but it is not helping in splinter-like feeling in throat, even after giving in 30 or 200 potency, it only release for a short period of time. In such cases, how can we manage?
I've had good results with Dolichos in those cases. Dolichos is a small remedy for splinter-like pain, and polycrest like nitric acid, arginate, natmure, they have a silica, they have splinter-like sensation. But when those polycrests fail, sometimes Dolichos comes to your rescue. So try Dolichos in potency.
Uh, I hope some you have you typed the email ID. I missed the connection. I think.
Sorry,
Hello,
yeah,
hello. Sir, I request you please type in your email ID if possible for the
yeah, yeah.
people to ask you queries. So I request the audience to please clear off your doubts from sir. You can mail us at webinar@homeopathy360.com, or you can even mail sir on the mail ID that is given in the chat box, and queries can be clarified because we need to begin the second session as well. So before winding up, I just want to thank you, sir, on behalf of the whole team of Homeopathy 360 for such a nice session and for such a nice relationship with BJN and Homeopathy 360. We are really thankful to you and grateful to you for that you spared out time from your busy schedule for our lectures and guiding the audience. So thank you so
Thank
much,
you,
sir.
thank you,
Thank
thank
you.
you.
So now I would like to invite our second speaker with us, Dr. Rashmita ma'am. She'll be discussing on Merck Sol, understanding Merck Solubilis through a case study approach. I invite Dr. Rashmita Petkar ma'am from JIMS Homeopathic Medical College to please begin the session, and now I hand over the session to you, ma'am. Ma'am, please on your audio. You're not audible. You have one second. Let's just check. There is an audio option on your screen, center of the screen. Can you please refresh once? No, no, ma'am, not now. You're not audible now. Also, just refresh the page once. I request you, ma'am, to please refresh from the. Yeah, yeah, yeah. I can hear you. Hello. Hello. No, ma'am. I just want to request you to please plug out your earphones for a minute and then try. No, not now. Also, you need to refresh the page. Hello. Just refresh from the upper corner. You have a refresh button. Just refresh it again. This page only you refresh. You'll join us again, and then we can hear you. Ma'am, please refresh the page from on the screen. By the time I just want to answer Dr. Abhishek, I am really sorry I couldn't take up your question. We You can mail us at webinar@homeopathy 360 because we are short of time, and then we also need to discuss as with our second speaker as well. So because this webinar will be there till 6 o'clock only. So you can mail us at webinar@homeopathy360.com, or you can mail Dr. Saptarshi as well at dr.saptarshib@gmail.com, and he'll clear your doubt. We can also connect to you. You can mail me. I'll connect to you, to Dr. Saptarshi, and then you can clear your doubts. Ma'am, I am audible now.
Yeah, yeah. Hello.
Yeah, just on your video as well,
Okay.
from the video button. Yeah,
Now,
yeah, yes, ma'am.
I guess with the
Just
headphones it's better. Fine. Should I begin?
yeah, yes, ma'am. Absolutely. Thank you so much.
Thank you. Yeah. Thank you, Dr. Yakshika. Okay, so all the homeopaths out there, we'll start with the Merck Solubilis today. So under Materia topic, I selected this particular drug because I had a very good case and fortunate enough to learn particular this drug. So the emphasis about this particular presentation that I would like to make is like different types of Materia Medica will try to understand like how are we supposed to as a Materia student, as a homeopathic student, how we can learn or understand, because as we all know we are different learners, like be it auditory or be it kinesthetic learner or visual learners. So to understand one form of learning, I have tried putting up certain tools and certain ways which I was fortunate enough to learn during my PG course, so that I've tried putting up. So after energetic session by Sir Saptarshi Sir, we'll begin with this materia topic now, Mercury Solubilis. Fine, so I'll start with first are objectives. So three particular objectives that I've tried putting up is understanding living materia medica via case-based study. That is, now why case-based study particularly? Because to understand any drug or any specifically materia medica, it's very essential to understand via case or to understand or see the living part of it. In the sense, for example, during my PG course, when we were subjected for the teaching programs, over there, what I have and most of my colleagues, when they got a feedback form in the from students, like which were the cases. So we had different types of teaching taken up for them. Like for example, this case based was taken via case, then we understand or derive the materia medica of that particular drug. So what we had noticed with the feedback form was case based. When I had taken, or most of my colleagues when they had taken, the response was really very good from the students, to the extent like the students need even what you can say visual audio visual presentation of a case, so that is like a cherry on the cake. So basically case based is one of the important way I feel to learn materia medica, and not just the bookish knowledge or what we see. So certain group of the students, they are unfortunate in terms of not getting patients, they don't see in their clinic, or maybe we don't know, but case based study basically will help us to understand how a particular drug is evolving. So that is why living materia medica, that is what we are going to understand. And the second topic, I mean the second objective is deriving the mental state of Mercurius Solubilis. So I was talking about the tool which I'm going to take up, that is the mental state tool. I'm going to explain in brief what is it and how it is useful and beneficial, not just in learning part, but also to understand or take up in case taking as well. And why herring guiding symptom? Because we often ignore our source book. The scenario is like we are more into the commentator, the particularly commentator's book. So well, let's not forget our roots. So main source book I have taken, that is herring guiding symptoms. And finally, so that it will be convenient and easy for us to understand the physical aspect, that is I've taken up Ellen keynotes, and from that we tried understanding, which we have already studied in our second year UG, that is toxicological study. So it will be easier for us to correlate and understand how is it like with the crude medication and with the potentize, what is the response. So these three headings say will enter into the case now. So first thing, I'm going to start with the case and then slowly understand how a Merck Sol or living materia medica of Merck Sol is. Okay, so I particularly remember this case very well. The first day that I had seen her, after the acute case, she had come for the chronic case. A particular time was given to this female. She was 50 years old female, sitting in the corridor of her OPD clinic there, and she was sitting like with the spread legs out, with her thali in her hand in the middle, and curiously and very confidently, she was looking at each and every doctor passing by. So this particular lady, I'll start with the preliminary data first. She's 50 years old, female, housewife. She's illiterate, religion Hindu. Father is 76 years old and mother is 72 years old. Siblings, she has two siblings, one younger brother and sister. She got married since 30 years back. And spouse, he's a 55 years old businessman. They run a small scale business out there. And she has two children. This particular case was taken just 2 years back. So we'll directly understand what was the chief complaint and what was the presenting complaint, and then we'll understand the life space in brief. So in the chief complaint, these two complaints which were her main concern was, first thing, MSS, bilateral knee joint. She had this pulling type of pain which was of +3 intensity. ओढून घेतल्यासारखं होतं. That is what in the Marathi, in the vernacular language she said. Bilateral knee joint pain. Ailments from, she said, she doesn't know, like very. And she also has numbness which was occasionally present there, swelling mild she was always complaining of, but there was no history of as such trauma. And these knee joint complaint bilateral was there since 4 years, like ODP, as you can see, sudden, continuous, and it was progressive. She was telling वर्षानुवर्ष जास्त होत आहे. Every year it is progressive, the pain, the intensity, and the frequency only when she exerts, when she travel, because she used to stay in a chawl. So when she used to climb up, that time it is to bring on the complaints. Fine. So looking at the modalities, if we see, she was, as I already told you, aggravation ascending stairs +3, aggravation walking +3, and she was better by just light oil massage that she used to do. And she was like, while taking bath, she used to specifically put little hot water. That is, by hot water fermentation, she was better +3. So this was MSS complaint. Second complaint, again leading to MSS words, the elbow joint. In the bilateral medial epicondyle, if you see, she was complaining of pain +3, though she could do all her work continuously, but then she was like, pain intensity was +2. It remains every now and then, it's always there. That is what she said. So sudden, continuous, progressive, and fortnightly the complaints would be present. So when we asked like why the complaints have started or what is the cause, like she said, it is a history. There was a history of carrying heavy weight, almost around 8 to 7 kgs. Like she used to go to the market or weight, while lifting bucket, something like that. So she used to say, or even when she was working young days. So then her complaints had started. Okay, and aggravation was exertion whenever she used to lift or use the hand particularly. Again, better was oil massage and better by hot fermentation +2. So these two were the main chief complaint that patient had presented to us. So next, if we see the associated complaints made, the main thing was she was telling, it was quite strange for us to understand. She was telling from the nose that she is not able to get the smell. Immediately, I remember we had done a test for her, or like a nose swab, like test, olfactory examination. Yet there was she said she is not able to smell it, but there is a particular thing later on I'll tell you. One thing that she can very well smell, tobacco, that I'll tell you, and what are the complaints that she had. So only anosmia, plain thing, in the associated complaint that she had mentioned to us, and this complaint was there since 5 to 15 years, and the complaints were like slowly it has begun. She particularly nothing, any incident she told for this. So this was the chief complaint which was there. If we now go into the life space, we'll try to understand patient's journey or patient's life since childhood to till the adulthood. How was it? What were the ups and downs? What has gone? So now, particularly if we see this life space, particularly I have tried exploring more of a IPR, that is interpersonal relationship with as your child phases too. Like in the childhood, how were you? In the adulthood, with the workplace, in the academics, with the people around you, how was the relationship? So as we move inside, you will understand. So the first thing, patient was from low socioeconomic state, and the patient was brought up by paternal grandmother, as her own biological mother had left patient when Patient was around 6 to 7 years of age. Patient doesn't remember. When I asked her, like, do you remember what was the state then? Your mother had left you 7 years. Do you remember? She said, I don't remember. But father had remarried, and apparently with the new mother, that stepmother, the relation was good. She said, "Ha, theek hota sagra kai." That is what she said regarding that. Nothing, anything in. Do you remember our childhood? She said no. Later on, when she was telling me, or when I was asking about academics, she directly, bluntly said, "मी शिक्षणात चांगले नव्हते. मला जास्त sports मध्ये interest होता. I was not good in so much in academics, but meant for sportive activities." So she was not an academic lady, basically. That is what she conveyed. Regarding marriage, when I was asking, hardly when she was around 20 years old, she got married. The IPR, meaning the interpersonal relationship with the husband, was good. They were staying in rented house at paternal aunt's mother, even after the marriage. So once what had happened, she wanted to wear the jewelry which the aunt was wearing, but father asked as why she wants to wear it. Instead, let paternal aunt wear it. She just wanted, because previously father had given the jewelry to her, and later on it remained with paternal aunt itself, because of some function was the shadi, so it remained with her. So later on, when patient was trying to get it, but father said no need to take it back. So patient literally felt very bad that time, and she said in Marathi that वाईट वाटलं माझा म्हणणारा कोणीच नव्हता, means बहुत बुरा लगा, कोई मेरा बोलने वाला नहीं था. That is what she said. So next, if we understand, next I was trying to explore about her, behavior with regards to in the society. How is she with the people around? Likewise. So she says, "Swabhav kasa hai tumza?" That is what plain question I had asked her. She said, "My life is busy. I don't like gossip around. अन्य बायका सारखं मला इकडे तिकडे बोलायला आवडत नाही. I don't like to gossip around. Hobbies are watching TV and being in the house and just enjoying my time." That is what she said. And during this time, she told me that masheri, you can see the picture out there. Okay, mashiri, this says that is a tobacco powder that she used to use it, and she says, "With that I feel better." Then I immediately asked her, "You say you don't get the smell." "Nahi, ह्याचा वास येतो." She said, "This I can smell it, and I feel better with tobacco." So because she was using almost 4 to 5, 6 per day, so out of shock, I happened to ask this patient, like, how about you get any complaints or you feel better? So she had said, "I really feel better with this tobacco application or use, basically." So that is what she said about herself. When I tried asking about her own sister, who is the only one sister, she said with the sister the relation is very good, but she is very very worried about her sister because the husband is drunkard and father-in-law is very aged. So she was saying फक्त मला तिचीच काळजी आहे, meaning उसकी ही मुझे चिंता ज्यादा है, तिचं पुढे कसं होणार. That is what anticipatory anxiety I have taken for it. And even later on the follow-ups also, when she was coming, she was always talking about her sister more in terms. Later we'll speak about that. So in the society, when I asked, "How are you when it comes to the society, people around you?" She said she never quarrels in front of others, did not take help of paternal aunt for rent amount to pay when husband requested. Meaning husband said, "अगं पैसे नाही आता, चला तुझ्या आत्याकडून घेऊया. We don't have money, so let's ask your atya or we'll take the money from her." But she was like, "No, I don't want to ask. एकदा सवय झाली की कंटिन्यू त्यांच्याकडे हात पसरायचा नाही." That is what she said. Like, "I don't want to ask for the money from them." So there was, but she used to not any things around the family or in the particularly in the society would happen, she would not directly say something out there. So what happened once, so what she said, "Why to get dependent, we will manage and no need to ask for their help." And she's quite image conscious also, plus two that I have taken over here. Going forward, so when I was asking about her relationship with husband, how is it your IPR with husband, त्यांचा स्वभाव कसा आहे and how are you dealing with him? So she happened to tell me one small incident about that. Once for the family dinner, for the outing they had gone along with her all sisters, meaning paternal sister-in-laws who were there. Patient had meat in spite of fasting day, and husband happened, meaning patient ordered for some prawns chili fries, something like that, and patient, it was actually at home they were fasting on that particular day. So husband scolded her for ordering so, and to avoid, patient was really very angry then, but to avoid quarrels, patient did not answer back. That is what she told, saying, "Step sisters are there आणि मला त्यांच्या समोर त्यांच्यासमोर भांडण नको अँड तमाशा पण नको, कारण एकाचं दोन करतात नंतर, इन द सेन्स की आय डोंट वॉन्ट टू फाईट इन फ्रंट ऑफ देम और से समथिंग टू माय हजबंड और मेक अ tamasha, because it will become a tamasha and people will, they will just talk about behind us. So that is what she said. So here again, considering all this, image conscious plus 3 is taken. Irritability, little contradiction also, that irritability would come up, so irritability plus 2 is taken. Now, the another two important incidents, like even we were shocked to hear that time, is particularly this two incident, like about the husband that she was telling. One thing is the incident one, patient once happened to be very suspicious because the husband got one call or message from one lady, it seemed. So she became very suspicious and quarrels with patient husband, got message from one unknown girl, left house to paternal. So because of that so much anger, she happened to leave or go to paternal uncle aunt's place. But then when she tried intervening into this matter, meaning paternal aunt, the minute she came at home, she tried intervening. What happened, Baba? What is wrong? Likewise. So she said, patient said, "Tu amchaमध्ये पडू नकोस, just leave, I will see." Meaning she doesn't even like that kind of satwan, that kind of consolation, or will look into the matter, because the paternal aunt has not said something grave. She just wanted to know or try to see it there likewise. So patient directly happened to say like this, "Tu amchaमध्ये पडू नकोस." Then from this, suspicious plus 2, irritability, impulsive, consolation, aggravation, that is what we can derive out of this incident. In incident 2, what had happened was quarrels with husband on some petty issues. She doesn't remember the date and exactly what was the issue that has happened. Issues in the kitchen. She happened to just, when they were at the kitchen counter, she happened to just strike off the knife on husband, lacerating his torso, and later next day she apologized, but there was no guilt, she said. And it was my sensitivity asking the patient, like, okay, नंतर काय झालं? That is what I asked later on, what happened? She said, त्याच्यात काय आहे? मारलं ते गेलं, रागात मारलं. That is what she said. So that from there, violent anger, that is what we have taken, and the violence, which that anger which causes so much impulse to hit or strike on the other. So this was a particular incident that she happened to tell me, and particularly I was trying to understand whether there is a guilt or any factor, but she said त्याच्यात काय आहे? I mean, what is there? I got anger burst, I got very anger attack, and I just happened to strike off on the husband. So this was the scenario. When I asked about her children, so after knowing husband, I was asking about children, how is it? How is with the children? So she's got two children. She said, "Tena mi marte, I beat them." This was the expression that she used to give. With the children, she says, "Te चांगले आहेत, good. If not obeyed, मेरी एकर बात नहीं मानी, अभ्यास करा, study or something like that, she will beat them with waist belt and hand." So either हाताने मारते किंवा बेल्ट घेऊन मारते. That is what she said. So irritable plus 3, violent anger plus 3. So again, we see here, that sort of anger in this particular lady. Then next thing is, if we see IPR with the children, what had happened once is this particular incident she told me. I said, like, तुम्हाला एवढा गुस्सा राग येतो, so how is it? If any incident other you can tell me relating to the children. She happened to tell this incident by herself. She had some work in the garden, in the market. So she said there's a small general store near her house in the chawl where she stays. So that is her own. So she tells child, please look uh, after the shop, I'll be back in few minutes likewise. But the child, in her own masti, she happened to go back to the room and she did not look after the general store. So because of that, when patient returned back, patient was very furious, and she says what she does is, first she catch hold child's neck directly. The child was hardly around 12 years, I suppose. Directly she caught out of child's neck and strangulated her for almost few seconds. And she even said directly to us, if I had to strangulate her for a few more seconds, she would have definitely died. And then she said, but I dropped her down on the sharp end, the edge of the table, causing head injury with bleeding. And ever since then, she says ki yeah incident nantar I'm trying to control my anger. But as such, certain incidences which are there with her loved one always used to occur. So her anger pattern, if we see, was quite violent and quite impulsive in nature. So through all the incidences, that is what we had found out. So again, when I was asking about the dealing with the sister-in-law, how is it with the sister-in-law? She said once this she herself narrated this particular story. She was like, once when sister-in-law, when she came applying one shade of lipstick and asked patient for her opinion, "Kasa dista hai? How is it?" Patient directly मुंह पे बोल दिया, "बावड़ा दिसते तू," meaning you look so stupid in front of everyone, meaning in the hall where everybody was there. To which husband scolded patient, मतलब ऐसा क्यों बोल रही हो? And husband said something to patient. Patient just dropped the remote there itself in the and patient ran because the sister-in-law would stay just nearby to her house. So ran to her house, and over there she wanted to beat the sister-in-law because husband scolded her, and because I said so and so thing frankly, why pay a sister-in-law has to feel bad or husband has to scold me. So she ran directly to their house, but over there sister-in-law had hidden somewhere, and brother-in-law, I mean, uska pati, had received all the beatings from her. And again and coming back to her room, husband's place, she left husband's father's, she went back to her father's place, leaving husband's house then after beating her. So over here I have taken rage, aggravation, contradiction plus 3, the impulsive natures and the destructiveness that she has, meaning with the anger she has to give away, she has to beat. That is what the expression of anger is seen in this particular patient. So if we see small this incidences around these people, when I was trying to explore IPR, it is very essential or to understand the pattern which is drawing. So this pattern is very important to understand. What we call disposition will help us in differentiating drug as well. So moving ahead with the physical character, so that was the story part of the patient. So she would look something like this. She was short, fat, hyperpigmentation on both the cheeks, and she had a wittish complexion. Perspiration, she said, nothing specific. Nape of the neck, sometimes it is, but it is more so of generalized nature. Elimination, she particularly told me by this symptom, like sheep dung like, that is plus 3, meaning exactly that is what the words were from her mouth. Hard knotty stool, and she takes Ayurvedic churna for this since 10 years. Urine complaint, if you see, she says like no complaints, burning, nothing of that sort, but 3 to 5 times per day. Okay, so coming to her menstrual complaint, she attained her menarche at the age of 13. She had regular cycle till date, like 1 or 1 or 5 months. That is her regular and proper cycle for her. Then moderate flow. Menopause she attended when she was 40 years, and she says there was low abdominal pain before menses, and pain would slowly decrease after flow begins. No complaints after cessation of flow. So in the sleep also pattern, if we see, it was a good sleep. Dreams, she says there's nothing specific. And thermally, when we tried asking her about how much fan do you want, or all the details that we try understanding to gain the thermals of a patient, the conclusion was she amphithermal towards chili, and she said मला जास्त गरम पण नाही आवडत, थंड पण नाही आवडत. She hails from Maharashtra, but I was trying to understand whether do you go to north side or somewhere south, whether any changes or have you seen. But she directly bluntly said like, no, I cannot tolerate both the extremes of the weather. So that was the thermal thing. So amphi towards chili. And the physical generals, if we see under digestion part, one thing she told me, like appetite was good, thirst was 2 to 3 liters per day, and every hour she has to sip the water, meaning thoda thoda good pina padta hai. Cravings, if you see, particularly she told tikhat, spicy, karam, that is what she loves, plus 3. Lemons she loves, lemonade she loves, plus 2. So she can even suck the lemon simply. So that much craving she had. And aversion as such, where I did not find anything, she said, Je kai mirte, te sagda khate me. She eats whatever like specific aversion is not there. So when we understand the family history, she said father died at the age of 85 years, and probably it was MI, HTN, and ONE. The mother she was talking about here is her biological mother and not the stepmother here. She doesn't have her whereabouts now, where she is, all extra details, but she said तिला काहीतरी वेड्यांचं झालं होतं. That is what she said. So query, high psychiatric illness in the past, and now she is having hypertension. That is what she said. Brother has vitiligo, autoimmune disease. Then past history, if we see, she had natural abortion when patient was about 33 years old. Coming to the physical examinations, I was specifically trying to understand the anosmia, why this come up. Physical examination and vital, it was within normal limits. On examination, when I tried seeing nodes, it was there was DNS, right-sided hypertrophied turbinates, and subjective loss of smell. So we gave her certain coffee powder so to smell in, but she was like, nahi yet, was nahi yet. She could not smell it, she said. Then under musculoskeletal system, there was bilateral crepitation and warmth was present on examination. Rest all restriction of the movement, everything was not there, nil. So going to the investigation that she had those form already on 1st of August when 2017 when it was done, X-ray of bilateral knee joint, there was osteophytic formation in the medial aspect of the knee joint. Space reduction was there between the two bones, so it was very evidently mentioned there. Then on first, another USG KOB was done. So she has this calculus, 15 millimeter size, it's in the right UV junction with mild hydronephrosis. Urine investigations, urine routine and blood was normal within normal range. So diagnosis was OA bilateral knee joint with tennis elbow, epicondylitis, both the hand, remember, with renal calcinosis. So this was her case. Uh, of this lady. So I've tried putting up totality in this, and I'll share my experience also as a learner, as a trainee, what lapses that I had seen and how it was clarified by my teacher later on. So specifically in this particular also one rubric is, one symptom that I did not mention was the suspiciousness, which I forgot to mention here. So it is rage, suspiciousness, impulsive anger, anger causing violence, dictatorial, consolation, aggravation, anticipatory anxiety, anosmia. One more thing, contradiction, aggravation. That is what I have not mentioned as well in this. So anosmia, want of smell, that is and the constipation, ship dunk like, and the tobacco smell, she is better. So and she craves for spicy thing, +3, and she loves lemons, as I told you that she would even suck those lemons free time whenever she has those lemon around. So considering this, I have done this, you can see I've shared the screen of on the radar. I have tried repertorizing this and the two important remedies that were coming up, because after taking or writing the whole case, when I was writing also the live space, the one thing that was coming again and again, even before doing the case processing, so that was a mistake that I was done. I was very much impressed with Nux Momika, because the way she is Petkar jala आपण मराठीत म्हणतो, the way she used to bluntly answer, the way she has no guilt or that kind of arrogance which she has. So that was evidently seen for me when I was taking case and when I have written the live space also. So that was the thing. But how to differentiate or how to understand this particular drug, that is sorry. So they were quite so I was very quite confused with this particular totality which was there, whether to go ahead with the Naxwamika. And as usual, after doing all the working, because that drug was set in my mind later on after taking and writing the case, I was very much pretty sure it is Naxwamika. So later on, obviously the physical data was helpful for me to differentiate and understand the PDF, though I have not shared here. But yes, PDF was really very essential to understand the physical data and come up to this particular drug Mercurius, and we'll understand what was the response also of Mercurius and Mercurius specifically. So Nux vomica, if we see both the aspect, if you understand the mind, very similar, both of them, irritability, and both will show sort of irritability as main their disposition. So irritability on contradiction in Nux vomica, both the side. The Nux vomica on the other hand are quite ambitious, quick, capable. They are protectors basically, and they will take up the challenge. I mean, in one territory, for example, a kink is there. They are done with the one territory. They won't win. They will win definitely over that, but they'll take up or chance to cover the another territory. So they are the one who will take very responsible along with their dutiful and highly competitive individuals. So that is what Naxwamika is. So they are warriors. So if we read commentators book like Philip Bailey, or you take up other commentators book like Vitolkas, you will see how they have mentioned beautifully these particular drugs, meaning Mercurius Sol and Nux vomica. So another this side, if we see, what Philip Bailey has mentioned regarding Mercurius is they are telling it is a kind of, they are very neutral individuals, meaning they will not try to, unless they are not provoked, they will not show the emotions. They will be all engrossed all by themselves. So the impulsive irritability, yes, their emotions or their reactions is really as sharp as Natrum Nux vomica, but important thing in this particular case that helped me in understanding Mercurius was with regards to the physical as well as the mind. So physicals, if we try to understand, this we know Nux is very chilly, and they have this always, because the action is on medulla oblongata, the nausea feeling, all the complaints. They have always this constant urge to pass stools, urine. That is what was more marked in case of Nux. Whereas in this particular thing, the very fact that she herself told me, "Mala jast garam nako, thand pan nako," so human barometers. You understand how this pendulum of this particular Mercurius moves around. So it is either they will want very strong, very heat environment they cannot bear, or very cold also. So somewhere it should be medium, or somewhere it should be balanced. That is what she said. Constipation, she herself told me, and when I was trying to particularly look after the symptoms, she had sheep-like stool. So Mercurius solubilis is definitely covering this particular constipation that she is telling. The other drugs we can think about is, meaning just for this particular sheep dung, like is opium and many other. So this was the criteria, assessing criteria that we had. So very first time which had come when the screening was done, Rostox was given, and later on after the case study that's done with the chronic case, later on we had given Mercurius solubilis 30 for this particular patient. And the interesting part that I'll share now was regarding the accessing. These were the points that I tried understanding what was the response of this particular drug in this patient. So first that we tried understanding is the mind. So anger frequency, because everything like anything like she's kind of touch me not, anything provoking or when she's contradicted, she is happy by herself, but anything provoking, contradicting, she would just react in, and that too in a violent phase. So every or after a month she came. So I asked her about the anger frequency. She said अधून मधून येतो राग, but at least काही कोणाला रक्त नाही काढत कोणाचं, meaning in between I do get this anger attack, but I don't bleed somebody like that. She told me the frequency when I was asking understanding. It was the first one after Merck Sol when it was given. So regarding second thing, I tried understanding anxiety of sister's life. I remember for almost 4 months she was telling it is still there. I'm still worried about her. Tisa kasa honar, because nobody is there, who nobody is earning in their family. How she will survive? That is what she was very worried about her sister. So that anxiety about her sister was still present for almost 4. But she said, "Ata jasta vichar nahi karat." That is what on the 5th month that she happened to tell this particular thing. Anosmia, nose. I was trying to ask her whether tumhala vas yeto ka. Every time we used to ask her like almost 4 months. So 3 months, first 3 months there was no response. I guess it was third month that she said like ata haru haru vas yeto. So we asked her whether out of 100% how much will you mark. So on the third follow up in third month, she happens to say like she does get around 20%. She is getting the smell now, meaning she can smell the cooking food or whatever that she is preparing or in the neighborhood. So that smell had come up after 3 to 4 months. Tobacco habits do, when I was asking her, because 5 to 6 times I have, while giving ancillary measures, we had told her like you must reduce this mercury application. It's not good for the health. So she was like she'll still continue it later on. I can do it. I'll try slowly reducing it. So tobacco habits were still present for 2 months almost, and then slowly she had third month she has slowly started deteriorate, meaning reducing the content of this tobacco application. Like 5 to 6 times had happened, like 2 to 3 times like that. But yes, she was using them. Regarding the main chief complaint that we were trying understanding is tennis elbow and the new OA knee joint complaints. She said both the complaint for first month it was not first month after the medication, the response was around 10% better. Later on, after 2 to 3 months, when we saw, the response was like around 20-30%. So there was a slow and steady improvement. So Merck Sol 30 was prescribed in this case, and new complaint as such was not there. But yes, she was also mentioning about her constipation, even though I had not written, but she used to always tell us regarding toilet lata theek hote hain म्हणून. So around third month that her constipation, most of the complaints had become most of the complaints had reduced down, and the frequency intensity of her chimp complaints were also better with this Merck Sol. So now we'll understand Merc Sol. I'll quickly introduce Merc Sol, and we'll understand the mind and later on the physical aspect as well. So we know common name is Quicksilver. It was first proved by a Master Hahnemann and his disciples. There's sometimes a confusion, Merc Sol and Merc Vivus, but the Merc Sol was first proved by Samuel Hahnemann. Later on, he said the more purified one is Merc Vivus. So that provings are also there. So people sometimes when they prescribe also homeopath, they might write Merc S or Merc Vivus, though they appear very similar and the symptomatology is also, of course, very similar to both of them. So coming to now we'll understand at the physical aspect what is the action basically. So sphere of action, and then I've tried understanding at the particular organs of which region this is affecting, what is the action, how it is helping, how where exactly this Mercosol goes and it affects our body. So this particular slide, meaning this particular data I have taken up from Boger as well as from Bird to understand the physiological action. So together I've tried clubbing up and making so that it will be easy to understand. So of course, since it's an antisyphilitic drug, we know the action is quite deep. So the blood is basically affected first. The mucous membranes. On the mucous membrane also, what is there? Physiological action. If we see, there is congestion, there is inflammation, there is hemorrhage, which is quite marked in case of this particular drug on mucous membrane. Glandular enlargement will be there, basically offensive discharges, which we'll understand later on, and the pathology, then on the glands it is there. So buccal, it is excessive fetor, the mouth, there is excessive, because of the excess salivation or excess, the syphilitic background this particular drug is having. So excessive fetor, the bad taste in the mouth, that was particularly marked in this. And as I told you, excessive salivation. All Mercurius group of drug has this, and it is quite very, that metallic taste and that excess salivation is very, very important when it comes to any Mercurius group. So salivary, so all the glands specifically are affected, mucous membrane, blood, and the glands like tonsils, then again throat, lymphatic space, you see a congestion and ulceration. And the liver aspect, if we see, there is a secretion of bile which is greatly increased, so they'll come up with jaundice. Kidneys again, so they catch holds of important structures in our body, this particular Mercurius. So kidney, if we see, there is albinuria, there is diabetes, there is congestion and quite inflammatory state, which we see most of the organs or most of the region of this particular drug. So cellular tissues are also affected. Bones, yes, there are nightly bony pains, caries. So inflammatory state, of course, which is running throughout, that we know. Skin, if we see, there are vesicular and pustular eczema and jaundice. Here later on we'll try to understand toxicological action with that of Alan Keynote, what the symptomatology is given, so that it is easier for us to understand or correlate and for understanding this particular symptom. So of course joints are also affected, and it is a right-sided remedy. So this is what the regions and what is it, or how this drug particularly the physiological action is there. That is what is been explained in this particular slide. So moving ahead. Now, to take up mind study, I have taken up the mental state tool so that it is easier for us to understand. For those who don't know this mental state tool, how and what it is, because at first, for any learner, it will look quite tiresome, and but believe me, like if you are practicing with this particular tool, not just your case taking improves, but you understand the patient, or patient understanding is very improved, and you do understand what are your prejudices also. So, last, I'm very thankful to my PG learning from DHAWALE, wherein I could my topic was also thesis on this mental state, and I really learned with the help of my colleagues and my teacher out there. So this particular topic specifically I have taken so that all of us understand this in brief and try to understand the mind with this particular tool. So what is important? We all know patient will present with symptoms expression both at emotional, behavioral level. So to understand this particular thing, we must first understand the situation, the circumstances, like what is it, kya hua tha, what was the scenario, what had happened, how did you react, whether you reacted with so much of emotions, with intellectually, or how, or what were the behavior, actions, and finally all on your soma, what were the effects, so how functioning is basically affected. So this is like a particular, kind of kundali that I always used to say for this, that you will understand the patient in a very accurate way, I can say. So to know how individual operates, that is what we must understand. So totality of the symptom to gain the whole patient person in toto, that will help us in finally arriving at the similima. So let's understand first. So this is coming to my second particular objective, that is deriving mental state of Mercurius Solubilis using herring guiding symptoms. So symptoms which were there presented by the patient, I have not taken in forming this, but I have gone through this particular source book, herring guiding symptom. So the symptomatology, we all know herring guidings have given the symptomatology, the abbreviations are given, which are again reflective from that of Bonninghausen. So that particular thing, like +1, +2, +3 intensity, that is occasionally confirmed symptom +1, symptoms more frequently confirmed +2, symptoms verified by cures +3, and symptoms which are repeatedly verified. There are other symptoms also which I have taken up and included, but these are the main four symptoms with classification, so that when I have marked in the mental state, you will understand what symptomatology and how and what level this particular Merc Sol acts upon. So this is what I was talking about the Kundali. Don't get mixed up with the picture. It is easy to understand. I'll explain you or how to understand or go about in understanding this particular case. So if we understand, it's always important, as I told you, understand the reaction, understand the situation first. So unless and until you don't know the situation, what has happened, how patient has reacted, we cannot directly write or take the symptom, because then the prejudices, our prejudices can also come up in that sense. And most of the cases, definitely the physician's prejudices comes in between, and that is then again it alters our case then, I mean, finally the similima. So I was talking about this reaction pattern, that you must first understand the situation, given circumstance, and how patient has reacted, what has happened. The reaction can be at the level of the emotion, it can be at the level of the intellectual, and finally it can you can present it by behavior, in the form of behavior, then functioning may be affected, and how are you in your family and the society. This is what we must understand. And finally, because of all the symptomatology from the mind, obviously this is a main computer system out there, brain, you will have the physical complaints coming up. So now in that sense, whether activities increase, decrease, what are the clinical conditions that have come up. So this is in brief that you must understand when you, even when you're going about with the case taking, this will definitely help us to understand. So moving ahead with this, I'll explain the all complaints. So first, this is a tool which is used around 12, 13 pages. This is the tool. So I'll just directly go to first the reaction page, so that we understand very well this particular drug. So this is not a symptomatology of the patient which I have discussed now, but of the literature which was given in herring guiding symptom. So obviously certain literatures we do not have the circumstances coming up, but they have seen verified. So that is what directly I have taken up from particular herring keynote, herring guiding symptom. Sorry. So if we see particular, one thing is important, aggravation anger, in the sense this particular because the irritability shade is there back in her, the disposition is there, slightest things, slightest provocations, they'll get out, they'll just throw it. Every drug has the peculiar reaction, every drug, we take up nux vomica, natrium mur, pulsatilla, ignitia, how they react to the grief, that is important, what, how much is the phase. So if we understand this particular Merc Sol, the anger is always there around them. So what will happen, so how anger gets portrayed, so there is great desire to commit or murder or commit suicide, baits, strike off, and violence. This, if we can try to correlate with our patient also, how the patient has reacted, though she don't remember the incident that has happened, because I was trying to understand or judge the incident, what has happened, that so much of anger, why she has to strike off on husband, causing him bleeding on the torso. So this particular thing is very, very important to understand the circumstances. So aggravation, anger +3, that is what symptomatology I have tried putting up, I mean the gradation. Next, in the whenever they are contradicted, again what happens? So it is +3 again intensity. There is a desire to kill. So how can you say no to me? So either they will, like certain drugs, they'll cry, certain personalities, certain drugs will just escape or run away from situation. These people will stand there, take out the sword, and will directly do their work. So fearful that she may commit some wrong and will kill herself. Sometimes there is a urge to kill. That is what specifically herring guiding has given. Sometimes urges her to kill her husband, of whom she is very fond, and she implores him to hide his razor. So much is the anger. Even she knows that is happening, but there is no anger ending into a guilt. That sort of thing is not there. But yes, whatever she gets anger provoked, she'll just take out knives, whatever is there, sharp instrument. The violence expression is very important in this particular thing that you must understand. Next, if we see particularly anxiety, so this particular drug is very important when it comes to anxiety also. Very important is how do they react. So in the anxiety, when comes up, there is excess of sweat, apprehensiveness, imaginary fears, fears that he will lose his mind, suicidal thoughts. There is great indifference to the loved ones, crying, hysteria, and hypochondriacal state will come up. So that is how when they are anxious they will come up. And last, at the end, one particular like ailments from fright, ailments from insult, mortification. If we understand, I have not put up their ailments from insult and mortification. Plus two is the intensity. Whereas if you see other group of drugs like Naxwamika, which is quite plus three or plus four in them, this particular insult or mortification, that is not so important, yes, but the intensity is low in this particular thing. Regarding fright also, they will show up in terms of great anxiety and this aggravation at night time, which will come up. And when we understand this, we under this and this pages all together, so we understand. I was talking about understand the life situation, what has happened. So personal thing is me, wherein my involvement is there, family, between the two family members are fighting and what you are feeling, then what are the complaints, that is in brief you must understand and try to gain the symptomatology or the mind symptoms. And it can be even the expression can be at the reaction can be at the level of the intellectual activity, like frustration, I'm not going to talk, so and so fight has happened. So what is it? Communication block, overthinking, mental exertion. So if you understand this particular two thing, like to understand the situation, this particular tool is very very important and is very useful guide for I feel for every homeopath to understand the given situation and how a person or every drug reacts. So this is of the drug that I have tried putting up here. So now, okay, so because of all this thing, finally we tried to assess what is the adaptation, whether the person is able to adapt with the situation, with the life, how is it. So in this particular, what I could make out finally is, yes, there is a issues with regards in the social character, social form. One thing, the illness is with the self, meaning because you are thinking, because of your complaint, because of your reaction so much, the adaptation, she's not able to adapt with the society and in and around with her surrounding. That is important. So we try to conclude then with the adaptation as well. Then coming to this is easily available to us because the way now I'm speaking, whether fast, slow, mid tone, how is it, and how is it whether I am repeating certain words, slurred speech, how is it. So if we see particularly plus 4 intensity, very hasty speech. But this particular lady, I remember, she was, whatever questions were asked, she would answer, stop it, and that too with confidence, looking eye to eye. So hasty speech is very important when it comes to Mercurius Sol, foolishness and slow. So we'll try to understand the mind aspect, the intellectual part. So we are studying emotion, intellectual. So this is how we have segregated in order to understand this. So why foolish speech or slow speech? Because the mind is affected at the intellectual level in terms of slowness. So we'll try to understand when we reach that particular slide. Behavior wise, if you see this particular lady, they are always, I already told, the speech is hasty. Behavior me, they are always in a hurry, that is plus 3 intensity. So what happens, they have very great restlessness, as though they have committed some crime and they always want to run away. This particular lady also, if you see, she would go hit, just mardo, and then again go come back to the husband house and then take up the bag, go to father's place again, after some days come back. So the desire to escape, restlessness, hasty speech is again very important, carrying plus 3 plus 4 intensity. That is what Herring has also told, and we have seen that in our case as well. And they are quite aggressive, they are destructive in their nature as well. We all know Mercury is syphilitic background, so this particular thing is bound to occur in them. So now coming to the intellectual aspect. So these two pages which are dedicated for are the intellectual aspect to understand this two. So I'll let you know first. So understand first the perception, very important. So intellectual me perception pehla hai, error of perception we all know, illusion, delusions, all other thing which comes up. Then memory, how is it? Then finally thinking, how is it guided? Like whether you're emotionally charged, emotionally thinking, changeable, fixed, how is it very active, emotional, that is what. So we'll understand this particular thing. Very important plus pro intensity symptom that is given is slow in answering question. They are quite slow because they feel they are imbecile, they are going crazy, they are going mad. So the perception, if you see, the confused state will be there. So in the first initial, if you open up herring or book, you'll see confusion, imbecility, and how it is reacted and why that has to come up. Why? Because of this, the memory is weak, very very weak, to the extent +4. That is what Herring has mentioned in his book. So because of this, what happens, the intellect is very weak. They will show every mark of imbecility, and there will be absent mindedness, which is most marked in this particular drug that we often ignore. But the mind symptom, when it comes to intellectual aspect undermined, you must definitely think about this drug as well. Then again, when we try understanding thinking also, it is more of a sluggish type, slowly, because loss of willpower. Then fanciful thinking, okay, this will come up, this is +2 intensity, and mostly when they are into delirious state, this will come up, the fanciful thinking. So but you must remember, definitely the weak memory ke karan all the other things which is getting affected also in the intellectual aspect. Fine. So confused, slow in answering questions, confusion, sluggish thinking, fanciful. Why? Because of all weak memory. And then she feels I'm going crazy. Likewise. This is in the intellect aspect. So if we understand other aspect like consciousness, decision making, confidence, how is person in this particular thing? So you must understand that Herring has also given unconsciousness +2. So this is something again important, like unconsciousness, why that state has to come up, and what are the reasons for this. So the stuporous state time, so it can be either some grave disease which they are having, or the child with having some mental retardation, they can show up with this particular symptomatology at the mind level. Then they always feel, as I told you, time is passing too slowly, which is +2 intensity. And when decision making or in emotions also, if we see, this is the intellect part, the impulsiveness, the impulse is the readiness to react to the situation is very very marked. So they'll take up decision. Bhandan zala, husband kare, fight is occurred with husband, she'll run away, she'll take up her bag and she'll go escape. She will definitely give back the response then, but she'll run away. So that you must understand the impulsivity in this particular drug. Confidence as such, the Herring has not given specifically, but what from case I have tried understanding is it's adequate. The way she would talk very bluntly, very actively, that thing made me understand the adequate confidence. There can be even poor shaky confidence as well in patients who are having this mental retardation when they are slow stupor state. So then considering all this mind specifically, that is perception, memory, thinking, and consciousness, decision, confidence, finally we try to understand how is patient judgment taking capacity, or how is the patient taking judgment. So it's good, poor, and that is being drawn, or I can say drive with the help of motivation, will, and drive. So MWD, that is what we try to understand. Tomorrow I may just say I want to become Miss World, but if there are no efforts from my side, so where is the motivation, will, and drive? So that helps us to understanding this particular the mind aspect of this. So now understanding the reaction pattern of this Mercurius Solubilis, the mind aspect, now let us go to the emotions part. So emotions, if we see, we have broadly divided this particular into anger, sadness, then love, hatred, and finally the fear, which is most important in this particular emotions when we try to judge or get the emotion, to understand the emotion basically. So if we understand first, we know anger, the underlying burning anger which they always have, which just blast sometimes when she's being provoked. So irritability is there. So anger is also, you define or you understand, so what type of it is. So it is irritability, which is +4, the rage, the fury, the violence which they will show up, the violence on the objects, violence on the person, as well as the Mercurius and we are talking about, right? Then coming to the sadness aspect, it is like because of this hysterical, because of her slowness or imbecility that she is thinking, she might sometimes go into the sad phase, indifference phase, like otherwise also she doesn't want somebody, people around, like the hysterical melancholia will come with inclination to murder. So even then also with sadness, that violence, that sort of is very very marked in this particular drug, that we must not forget. Now coming to the love aspect, what is given is they are imaginative and amorous. This is not so well marked as we see in most other drugs, but yes, amorous tendency, the sexuality which is there is just of +2 intensity, Herring has given. And suspiciousness, is what Herring has mentioned with +3 intensity. She feels like everybody is her enemy, that she should not talk, she should not mingle with them. If you see our particular patient also, she happened to tell me this incident saying that त्यांच्या मोबाईलवर फोन आला होता एका मुलीचा. That's why I was very anxious. I wanted to know who, what it is, and she started questioning, and finally after having fight she left. So this suspiciousness is also very important, along with the anger shade, which is so well marked in this particular drug, that you must remember. Now coming to the fears, I was talking about the anxiety. Over here we try understanding fear. So fear mein kya hai? Fright. How does the person react this Mercurius? So anxiety, if we see the three types which are there: depressive, agitational, and anticipatory. Particularly this drug had anticipatory, that we had seen in the case as well also. Desire to flee, with nightly anxiety and apprehension and the restlessness, and with the physical complaints that will come up. So that's very, very important in this particular drug, that you must understand. So we've tried understanding the emotions, the cause, the intellectual part, how person this particular drug reacts. And then finally, a very important aspect we must not forget is regarding the functioning. So when my whole my mind is working, how at the body level I am affected. So if we see this particular drug at the functioning level, very important, the individual is whole as in toto is affected. So very important, every book right from Alan Keynotes to Herring, all source books are talking about when the sweat, they will sweat incessantly like anything, but there is no relief with that. With when there is suppressed foot sweat, that is what +3 intensity symptom was there. There is uncontrollable desire to commit suicide. So it's very, very important. Like this sweat, they highly get troubled with, though they sweat profusely, but they do get trouble from it. And of course, the addictive habits that we have seen, this was +2 intensity, tobacco, chewing, or take up alcohol, beer, which is there, but not so well marked as we see in case of Nux personalities. Fine. So considering this, everything, the balance is definitely affected. So we try understanding functioning कैसे affect हो रहा है in particular drug में. So coming to the sleep also, if we understand, again an important part of our life, unrefreshing, very important. So उसके कारण क्या होता है? Because of the anxieties, because of the complaints. So what are the complaints also which Haring has given? Ebullitions, congestion from itching, from seeing frightful faces, and frequent waking. So I was talking about the sweat also. So sweat during sleep, the sweat is there, which is +4 intensity. So sleep is affected. Why? Because of the sweating complaint, because of the anxiety which is marked. So the anxiety complaint, rageful, all this particular uh, disposition will try understanding when we go to understand that kundali which I was talking about. So in the dreams, if we see of water, thieves, animals, shooting, misfortune, see all the symptoms which are taken, I have tried putting up in this tool, is all again from Herring's guiding symptom, the mind aspect of Herring itself. So now finally in toto, to understand this particular mind of Mercurius Sol, we are covering the all aspect of the mind. So okay, this one more slide is very important to understand how a person, whenever you're taking case study also, I remember asking my actuary, like, how do we understand with this? Because there are different ways. With this particular one slide itself, you can enter or understand the patient in general. So strained relationship, right? That is what this particular drug has with the loved ones and with the children. Basically, that is what we said seen in this case. So it's mostly in the society, family, where the strained relationship or where the incidences will come up. Okay, so IPR exploration is very important to understand the patient. So now I was talking about this reaction pattern to understand. So that is what we have seen: ailments from fright, insult, mortification, then anger, all this causing all this particular emotions, and the intellect. What are the symptomatology that has been thrown or reflected by this sort of reaction? So if we see that the disposing characteristic of this particular drug: suspiciousness, which is +3, anger, which is always underlying, +4, irritable, rageful, that is the response, and that is the reaction. Anger, again, that is again a disposition, so violent objects and towards person, indifferent, they'll go indifference, hysterical melancholia, and they can even murder and impulsivity. That is what now try to correlate with the case that we have seen earlier. Again, sorry, second thing is regarding anxiousness, which is +3 in intensity. So we have seen our patient also quite anxious. I remember all first 3 months, even during the case taking, she was talking more about her sister's worry. So माझ्या life मध्ये मला काही tension नाही. I'm worried about my sister's life. That is what she used to always say, like for the follow up and even during the case taking. So the fear, apprehensiveness, sweat, indifference, desire to escape, the hysteria, the hypochondriasis, that will all come up. That is what the main disposition anxiousness ke under. Then to understand this all, now how patient is reacted, we know behavior which is easily available, hurried speech, aggressiveness, destructiveness, and how is the functioning affected. We have seen because of all the patterns, functioning in the sense suppressed sweat, addictions, different functioning that has been affected that we must understand. So how a body, how mind is affecting our body, how functioning is getting disturbed. Then later on in the, if you see, understand activity and inactivity, meaning what are the complaints like hypothyroidism, hyper, that we must understand that basically the activity of the disease. So imbalance is created because of the all deranged mental states. So what are the things? So one thing which Herring has given was manias with liver complaints. So liver complaints can be there, and with that the psychiatric issues like manias will be there, depression, so that will come under activity. High, okay, it's more enhancing, whereas inactivity, so insomnia, drowsy, sleepy feeling, the not getting good sleep, sweat is causing complaint, then depressive episodes, anxiety disorder. So these are the group of diseases that can come up in mercury, very important. And then finally we try to understand patient in the family as well as society, how the patient works, how the patient reacts, and what are the symptomatology, and how what is the given situation and how the patient reacts. So this is all about the mind of Mercurius that you must understand. So this is a systemic tool that we try to understand mind. You can take up of any drug or any case, so it is very easy to for us to understand. We don't miss out anything. Of course, you need a grasp on this to understand this tool, very important to this particular tool. And we also have this dream analysis, like if she is having certain dreams about patient, how, what is the situation, what is it, and what is the interpretation that can be drawn. So that is the whole mind of the Mercurius that we have tried understanding. So that was the last point I'm going now. Maybe 10 more minutes I'll be done. So very important is why I have taken toxicological is it will be easier for us because we already know most of toxicological aspects. Like in the second year it was dealt. It will be easier for us to understand the Allen keynotes as well, meaning the symptomatology, physical aspect. So if I go ahead with this, very important in the toxicological symptom of mercury poisoning, what is given? First is the anemic state. What happens when a crude mercury goes? I'm sure you must be aware of the Manimata disease or, the other Hatter shake, these all terminologies which we had studied or read at least. So very important is when a mercury or crude mercury goes inside, what happens? So first thing is RBC disintegration. So there is fatty degeneration in the liver and kidneys. So what is the consequent thing? So how you will see what are the symptomatology? Obviously, the pale, anemic look, the shriveled look that patient is going to have. For this patient mercurius. So if we see in the mouth also, series of important symptoms which are there in the right side that you must understand. As we all know, once you take up that poison, what all happens, it will be easier for us to understand this symptomatology, the materia reflection basically. So if we see toxicological, the metallic taste followed by burning pain in the mouth, throat, epigastric, and there is rapid severity of this, and there is excessive thirst. If you see tongue also of this particular patient, see the right side symptom, I must say, the tongue will be moist, but yet they will have that intense thirst, and the salivation will be quite profuse, and it is offensive in nature. Remember, it's a poison, right? Crude. So, and potentia is given the offensivity, which is the hallmark of again the miasm, syphilitic miasm that you must remember. Tongue, if we see, it is large, flabby, with imprint of tongue, mapped tongue. So, what are the clinical conditions that can come up? The mumps, diphtheria, tonsillitis. The other symptom is a clinical condition that can come up in this particular drug. So it's very important. The minute it goes inside our body, the mercurius, what all things, the left side crude happens, and the right side I've tried showing the potentized symptoms, the potentized drug symptoms basically. So very important drug in case of toothache. Here you can compare with meserium also. Meserium, here in this particular drug, the crown is decayed, loose and painful. So crowns are affected, roots are fine, whereas it is just vice versa, opposite in case of meserium drug. So it is a very good remedy in case of toothache. Remember, ask about the thirst, ask about the look at the tongue, very, very important. And the offensivity in the room around will be definitely there. So you must think about Mercurius in that case. Now coming to the other complaint, GI complaint, if you see when Merc is taken, the nausea, retching, vomiting, mucus with often blood, teen, diarrhea. So that syphilitic trait which is marked is very important. It goes deep at the organic level. So very, very important. Remember the syphilitic background. So what are the consequent complaints this side? Morning sickness, profuse salivation. So dysentery, very important. The Mercurius group carries, we think about dysentery, we think about Mercurius drug when it comes to dysentery, the bleeding which is happening. So the stools are slimy, bloody, colic with fainting. There is great tenesmus during and after, and they are not better even by passing stool. This is followed by chilliness and that cannot finish sensation, meaning urging all the time, that will be definitely present when it comes to the stool or diarrhea, dysentery. The more the blood, the better is the indication. This is what Allen has given about this. So next we understand the GUT both reproductive system as well in this. So what few symptomatology I could get to understand the crude aspect by what happens in the reproductive system. So there is infertility, spontaneous abortion, stillbirth, congenital malformation, and there is decreased sperm motility, and specifically in those workers which was seen who are working in this mercury factories basically. So what happened this side, if we understand, very important, we know Mercurius was very, very syphilitic actions ke liye diya jata hai. That is what Master Harriman has also talked about. Look at the second last symptom that I have put over here. So that is what Master Harriman has said. Syphilitic affection, rarely indicated if the tongue is dry. So very important, one of the statement that Allen has given this. So coming to other complaints of the syphilitic is, we all know gonorrhea complaint, phimosis, chancres, with particular that green discharge which is marked. The urethra, at the tip of the urethra, there is burning pain, and the last few drops will burn, and there is constant urging even to urinate. So there is pain as well as this urgency which is there. Prepuce is hot, swollen, edematous, and sensitive to touch, threatening, suppurating bubo. So understand the hold of this Mercurius at the at the skin level, at deep into your tissues or into important organs that we must understand. Then finally, looking at the female complaints, mammae is painful as if it would ulcerate, and at every menstrual period, milk in the breast instead of menses. So this is one of the keynote that has been mentioned for FRS complaint that we have seen. Now coming to the other complaint, the neurological complaints, we see Manimata disease, particularly this was in Japan, I suppose. So if we see what had happened, there is the fish around where the water was discarded, this mercury. What has happened, the fish around had died, and the people who were consuming that water was having this neurological damage. So the name disease itself was named as Manimata disease. So there was visual loss, there was ataxia, there was hearing loss, mood changes, memory problem, and many other things. Another terminology that we must know also that can help us in understanding symptoms is Hatter's shake, that is irritability, low self-confidence, depression, apathy, shyness. So with irritability, everything, the personality complaints will also come up. So shyness, mental confusion, emotional disturbances, and muscular weakness. So on the consequent right hand side, we see the symptoms which keynote Allen has given: trembling extremity, especially hands, paralysis agitans, and they have this poor memory that we have seen in the mind as well. Almost a light slide. If you see in the respiratory side, they have given respiratory distress in case of toxicological symptom. I could not get more complaints under this. But right hand side, if we see now, what Alan has given is they have this dry, fatiguing, racking cough, which is of 2 paroxysms. Okay, so this will specifically action is on the right side, and we all know syphilitic action. So deep, grave disease that will come up, pneumonia, the hemorrhagic tendencies which is there in this, the catarrh with much sneezing, fluent, acrid, corrosive nostrils, raw, ulceration, the yellow fetid pus discharges, nasal bone carries. You remember the action on the bone as well, very important, the ulceration which is marked. Next thing, if we see, look at the left hand side, the acrodynia, that is a pink disease we call, another terminology in case when you read toxicological poisoning of mercury. Pink scaling palms and soles, flushed face, pruritus, photophobia, profuse irritability, and insomnia. So if we see, look at the skin complaint this side, what Alan has given is there is intolerable itching over the body as from insects, from evening, from the warmth of the bed, pleasant on scratching. So they feel better when they are scratching. So that continuous itching complaints are always important. I mean, will be there in this particular drug that you must not forget. But another important thing, as we see in case of drugs like Argentum nitricum, the pathological general, we see ulceration. This particular drug also, after all, a syphilitic background, isn't it? So very important, the ulceration. You take up any organ, skin, bone, glands, organs, there are these ulcerations. So what is said is ulcers on the gums, tongue, mouth, throat, inside of the cheek, profuse salivation, they are irregular in shape. So this is a crude action what happens right now. And then the left hand side, if right hand side, if you see the bone diseases, which we all know, with or without suppuration, the cold swelling, the clinical condition that can come up, cold swellings, abscesses, which are slow to suppurate. And it is said that they should be given in low potency when you have the suppuration, when you think about Mercurius. Syphilitic ulcers are circular attacks. The posterior part of the mouth, throat as well have well-defined edges surrounded with a coppery hue and do not extend from their primary seat. So the form of ulcer is also very important to understand. And we all know glandular action on this scrofulous action of children. So coming towards the last part, very important, keynotes, the keynotes which I could not tell you. So important thing is otorrhea, very important action in the ear. So bloody offensive discharge with stabbing, tearing pain. Obviously right-sided, and remember the nightly pains which are important. The furuncles, boils which are there in the external meatus is important. The polypi, fungus, excrescences in the external meatus, which finally causing this epistaxis when coughing at night, sleep, hangs in dark clotted string from the nose like an icicle. This is very, very important symptom. We know many group of remedies for epistaxis, like recently I was discussing about millefolium or other group of remedy, lotus alba. So this particular thing, the character is very important. Clotted, dark clotted string from the nose like an icicle, very important. Next, I told you about this particular symptom, profuse sweat with no relief. So however much they sweat, but there is no relief with this. They can even, their sleep is in fact disturbed because of the sweat as well. Nightly aggravation, we all know syphilitic background, and the aggravation in general, if we look around this, at night, wet, damp weather in autumn, in summer days and cold damp nights, lying on the right side, and perspiration. So these were this is one of the main important aggravating modalities that you must know. So that's all about the whole drug that I want to talk about. This very important thing, you must understand the syphilitic background of this drug, understand the mind. The emphasis of my today's session was to study, we can take up different ways to study Materia Medica, like take up some tool so you can understand. Not only it will help you in case taking, but it will make sure that, you know, it will show your prejudices also, where you are like when you're filling up this mental state. So it's very important to understand this. Then different ways. So this was one way which I would teach, or which I would learn toxicological, because already in ideas we have regarding toxicological studies. So try to correlate. Then some other techniques which are there to study. So I felt to take up this study so that it will be easier for the learners to understand this particular drug. So physical and mental can be studied in various different ways to understand. Finally, very important is understand the essence of each and every drug. Important is the living materia medica. Chalta firta कैसा है ये आदमी औरत, कैसा है हमारा पेशेंट, क्या, what is the essence, main thing that we must understand. I'm very fortunate for this particular case. My teacher there, Dr. Bhavik Parekh sir, he was the consultant. He had prescribed this and made me understand what is the role of, you know, Mercurius Sol. Instead, I was very much fixed about with Naxwamika. And of course, Dr. Yogesh Niturkar sir for giving me this platform to share my case, and my PG Institute for all the learning which I got in during that phase, the 3 years which were very, very essential and important in my life. So PALGHAR phase, obviously, MLD MHI, I'm thankful for all the learnings that I received then. And of course, the current serving institute that I'm here, Jim's Homeopathic Medical College, it's a good opportunity that I'm learning and seeing new patients. So thank you very much, everyone, for your patient listening. Any doubts, any inputs as a learner, I would like to know. You guys want to say something? I'll hear. Yakshika, Dr. Yakshika.
Yes, ma'am. Yes,
Yeah.
ma'am. Thank you so much. It
Thank
was
you.
such a great session. I want to request the audience to please put type in your questions so that we can discuss with ma'am. And ma'am, yes, we have a question from Dr. Dimple.
Yeah.
What about image consciousness? One incident where she suppressed anger when in company of paternal aunt because it will be a tamasha, like it will
Yeah.
create a tamasha. So what about that image consciousness?
Image consciousness, when we take about this particular thing, I have not taken it as, what you call as a specific symptom. Image consciousness, which is there in most of the particular, like you take up any drug which is there, but what type, how does she react, so her reactions are being taken. So considering that as a disposition, because when it comes to disposition, we understand through which the remedy or the symptomatology grows. So understanding the image consciousness of mind in this particular drug was, this is not so important when it comes to image conscious, because this is there in most of the other drugs as well, but her other peculiar conditions, important symptoms I have taken. So if you see in the rubrics also, I mean the totality, I have not taken up that image consciousness, rather the reactions are being taken in that. But yes, I'm not denying the fact that particular dispositions which are there are really very important to differentiate the group of remedies.
Thank you, ma'am. There is another question. How to differentiate between merc and alumina with impulse to kill and time passes slowly?
Okay, very important question. Alumina is a clay. We all know how they are. What is the from where they are coming up? They are always a loner, basically. Alumina drug, if we see, they are all by themselves. Very important. They will not mingle up with others, and the very fact clay, meaning they will absorb the things within them. And particularly, what she has asked regarding the time passes slowly, right? So we must understand what is it like exactly. What are the situation? How does the patient react in that? Because if we understand this particular drug also, like this particular case, if we see, she was very quick in answering, talking, and her reactions would be very quite fast about her. Whereas in we see alumina, obviously that symptom which is there, particularly time passes slowly, is very marked there. But understand the dryness which is there in the clay alumina, right? That's very important. So symptomatology, yes, certain thing we might, like for example, I got impressed just thinking about Naxwamika, the irritability, and I had completely forgotten about or ignored or kept in dark zone Mercurius. So understand, go with the physical complaints also, which can help us in differentiating. Hello? Hello?
Ma'am, yes, ma'am. Thank
Yeah.
you, thank you. We have more questions. I request yes, ma'am. From Dr. Mohammed, he's asking any specific peculiar symptoms of mercury which you can quote.
About this particular we are talking about. It's patient or about this, yeah.
Like if you can, I think he's asking about the polycrest drug merc. If
Okay.
you want,
Instead,
if
I
you
will
can
tell
quote.
about this particular, which I learned recently while I was doing this working of the case, was like sheep dung stool. That is what I will specifically tell, because this is quite marked in this particular drug. When I was trying to do PDF and try to understand which are the symptoms which are actually covering this particular when it comes to physical, the sheep dung stool, which I was just thinking about opium and other group of remedies. But this drug is very, because Mercurius, we think about just the syphilitic action and the dysentery, but the diarrhea, which is very important, that she told, the constipation, hard, lumpy stool. So that I would say will be very peculiar one, which I have learned recently. And another peculiar thing which I've just told is the icicle, that bleeding which will be there like an icicle. Though I have not seen that particular thing, but that is quite fascinating. That is what I feel. This particular hemorrhages, the epistaxis, which this drug has.
Thank you, ma'am. From Dr. Utpal, there is a question. Why not Merck 200? Because the mind symptoms were prominent. Why not selected Merck 200?
In fact, we had gone first with the Merck 30 first dose. After giving this Merck 31st dose, there was no response. So we had directly for the second or third follow-up, we had gone for second follow-up probably, we had gone for Merck 0/1. 200 was not given because there was starting, as I told you, there was always, there I had a confusion with this particular, coming up to this drug, or I was not understanding because I was still very much impressed with Nux vomica and I wanted to give Nux itself in this case. So particularly if we see this, the potency which Utpal ji is asking, 230 was given. There was no response in the sense her anosmia complaints, everything was SQ, though it was 1 month only had passed away. We then thought about giving 0/1 that will be harmless and we can repeat it. So from this 33p was given, we had made 0/1 directly 7p, 7 powders were given to this patient. So later on, when we increased and we had seen with LM potency, there was very good response with less of any aggravating or any new complaints were not there. To the extent she told that her constipation complaints, which she used to take churna, she has stopped it around 4th month when we had started with 0/1 potency. So I felt that was definitely a mistake. We had gone to 0/1 potency, and that was really good enough for the patient then.
Thank you, ma'am. And he's asking in Merck 13 water or sugar or globules. What did you prescribe?
It was not in the water. It was the pills which were given to the patient.
Okay. So can you please, from Dr. Gauri Nandana, can you please create a complete, like in short, a picture of Mercurius with comparison to Nux vomica?
Nux vomica, yes, very important. As I told you, showed in one particular slide, mind aspect and mind aspect of both the drugs is very very similar. The reaction is very similar, impulsive, but what differs with them is the sphere of action, the physical complaints which is marked. That is what like I have understood, because while going through all the commentators understanding of this drug, मर्क सॉल अपने ही अंदर रहेगा, उनको दूसरों की पड़ी नहीं है. दे आर नॉट दैट कॉम्पिटेटिव टेकिंग अप दिस पर्टिकुलर एरियाज और दैट पर्टिकुलर और फिनिशिंग अप दिस स्टार. दे आर नॉट दैट ambitious. If we see that, we see in case of Mercurius, they are very skilled competitive individual that we have seen. And Nux vomica, very important is the action on the brain, specifically the medulla oblongata centers, and because of that the urgency of the stool, the ineffectual desire to pass stool urine, that is quite marked. So I feel based upon the physicals you can definitely understand. And another thing is the neutrality which is marked in Nux vomica. They are graceful, they are very good. So what Philip Bailey has talked about is about Michael Jackson, meaning they are so serene, they are so artistic also. At the same time, they are neutral individuals. They do feel bad. There is sympathy in them when the things around are not good. So they will do the work for some cause. So that is there in case of Mercurius. This is what I can tell you about Mercurius and Nux, basically in short to tell.
Thank you so much, ma'am. Great. So we come to the end of this session, and we have only 5 minutes to 3 minutes to wind up. So before we wind up, I want to thank you, ma'am, for your contribution, and on such a short notice, you prepared such a nice presentation, and everybody enjoyed it so much. Thank you so much for guiding through this case studies, the Merck Sol remedy, as well as on behalf of Homeopathy 360 and BJN Group. I want to personally thank you for your contribution, as well as from Dr. Yogesh Niturkar sir. I want to thank you because he is also associated with this series of ours. So thank you so much, ma'am, for your efforts. And big thanks to the audience who have been with us for such a long time and patiently listening. So thank you so much. I put the link in the chat box for downloading the certificate. You can fill the Google form and download the certificate from the same. Also, I want to announce that we have a webinar coming up today at 6:30. Today, tomorrow, and day after tomorrow on Monday. We have a series started with Asha Homeopathy Maharashtra. So Dr. B.S. Bhosle sir is coming at 6:30 today. So whoever wants to attend the same, you can visit on the website. I am putting the link in the chat box so that you can register for the same and attend the webinar, which would be again a great webinar. I'll just put the link. Wait. Dr. B.S. Bhosle will join us at 6:30. So yes, he is the director of Asha Homeopathy, and he'll be discussing a role of homeopathy in depression as well as some of the tips while dealing with cancer cases. So whoever wants to attend, you can visit this link and register for the webinar. As well as tomorrow, we'll be coming at 3 o'clock only again with another topic on recalling the anatomy of tonsils and its homeopathic management by Dr. Purav Desai, and drug relationships by Dr. Mukund Udachankar sir. So I hope everybody will be us for tomorrow as well. And today also I think people would be joining us at 6:30. We have a webinar. So thank you both the speakers for today's session, as well as Dr. Rashmita ma'am, Dr. Saptarshi sir, and my whole team, as well as such a patient audience and patiently listening to us. So thank you so much. We come to the end of the day. So we would wind up. Thank you everybody. For any queries, you can mail me at webinar@homeopathy360.com.